Good morning, everyone. I hope you all are fresh now after your weekend break. In the previous class, we started with endocrine, and in endocrine, we completed the most important topic, and in very detail, we discussed about diabetes mellitus. Then we started with thyroid. Now let's continue with endocrine, and today we will try to finish it very easily. So let's make a heading. Next hormones in endocrine we will write is hypothalamic, pituitary axis hormones. Hypothalamic pituitary axis hormones. In this chapter, we will discuss certain hormones released by hypothalamus and pituitary. The first thing we will discuss is growth hormone and related hormones. H for hormones. Then we will discuss, after this, we will discuss growth hormone and related hormone. Then we will discuss ACTH and corticosteroids. Then we will discuss about gonadotropin releasing hormone and FSH and LH. And after that we will discuss estrogen, progesterone, testosterone. Okay. So this is the agenda for now. So let's start with the first one. Okay. And then we will discuss rest all other hormones, miscellaneous hormones like oxytocin, etc. Okay. Now, let's start with the first one, a very small topic, growth hormone and related hormones. Let's make a heading, everyone, growth hormone and related hormones. चलो heading बनाएंगे सारे के सारे, growth hormone and related hormones. Now, let's make a diagram for it. Sir, suppose this is hypothalamus. This is pituitary. ठीक है? H for hypothalamus, P for pituitary. We know that pituitary releases growth hormone. Okay. And what stimulates the secretion of growth hormone? What increases the secretion? Growth hormone, releasing hormone. We all know this part. But what inhibits? Can we write it as growth hormone inhibiting hormone? Growth hormone inhibiting hormone? Yes or no? Very simple. Now there are two growth hormone inhibiting hormone. We will write somatostatin and dopamine. So these are the two hormones which inhibit the secretion of growth hormone. Now what happens? What is the action of growth hormone? So this growth hormone goes to the liver and it acts on a receptor. You'll write JAK-STAT receptors. Okay. It acts on JAK-STAT receptor. And from liver it starts the secretion of one protein known as IGF-1. IGF stands for insulin-like growth factor, which is also known as somatomedin C. Somato means which is mediating the growth, and it produces growth or anabolic effect. So can we say that growth hormone produces its anabolic effect through this part? Now, before going further, we will write a very important point. The first point, which is an MCQ, you will write that all hypothalamic pituitary axis hormone, जितने भी hormone होते हैं hypothalamus and pituitary axis, they all have GPCR receptor. जितने भी हाइपोथैलेमिक पिट्यूटरी हॉर्मोन्स होते हैं, ग्रोथ हार्मोन, एसीटीएच, है ना, दे ऑल हैव जीपीसीआर रिसेप्टर एक्सेप्ट टू. One is growth hormone and second is prolactin. These two hormones have JAK-STAT receptors. आसान हो गया काम. These two have JAK-STAT receptors. So some students have joined now. Don't worry, I will explain you this part again. Last point you will write is IGF-1, insulin-like growth factor. Although it is not a hormone which is secreted from hypothalamus and pituitary, it's a hormone which is secreted from liver. We know this part. It has tyrosine kinase receptor, which is similar to JAK-STAT receptors. So if I'll ask you a question, that what is a receptor of somatostatin, what is a receptor of dopamine, what is a receptor of growth hormone releasing hormone, the answer is GPCR, G protein coupled receptor. I hope this makes sense to you now. Yes. Okay, so some students have joined now. बच्चा लोग, we are starting with, so this is what inspirational quote, the first slide. Then we are starting with this part. You don't have to write this part, the students who have just joined, but just to make you comfortable, we are starting with hypothalamic pituitary axis hormones, HPA axis hormone. So these are the various hormones we will be discussing now. And the first topic we are starting is growth hormone and related hormones. Now we have written that growth hormone which is secreted from pituitary, P for pituitary, acts on liver through JAK-STAT receptor, which releases IGF-1 somatomedin, which causes growth or anabolism. It is stimulated by from hypothalamus growth hormone releasing hormone, and it is inhibited by growth hormone inhibiting hormone dopamine. Easy. अभी आते हैं बेटा, अभी आते हैं, सब पे आएंगे. जी क्यू है, जी एस है. अब इनहिबिटिंग है तो कौन सा होना चाहिए? अगर ये इनहिबिटिंग है तो जी आई होना चाहिए, बाद में पढ़ेंगे इसे, है ना. स्टिमुलेटरी है तो जी क्यू या जी एस होना चाहिए, वो हम बाद में देखेंगे. सो दिस इज अ पॉइंट विच इज एन एमसीक्यू, यू मस्ट रिमेंबर. इससे आपको सारे रिसेप्टर्स के बारे में यू विल कम टू नो अबाउट ऑल रिसेप्टर्स. नाउ रिमेंबर वन पॉइंट विच विल मेक योर लाइफ इजियर, is you'll write any drug which will end with the word tide and in. Any drug that will be ending with the word tide or in, it will be a peptide in this section, remember, and they are not given orally. They are rather given by injection. इस बात को हम ध्यान में रखेंगे. Any drug in this chapter ending with the word tide or in will be a peptide, and that drug cannot be given orally. So this will make your life even more easier now. You don't have to remember each and everything. You have to remember this funda only. Agreed? So keeping this thing in mind, let's talk about certain hormones. The first hormone we will write that we have made recombinant form of growth hormone releasing hormone. We have made recombinant form of growth hormone releasing hormone. The drug name is sermorelin. Tisamorelin. Now can you tell me their route? These drugs are given by subcutaneous injection. We know this part. Now what are the uses? Sermorelin, we will write that it is used for diagnosis of growth hormone deficiency in pituitary. Tisamorelin, just write same use. Second, it is also given for the treatment of lipodystrophy sorry, in HIV positive patients. What is that? We will discuss in HIV. So this is all you have to remember about this drug. Rarely used. These drugs are rarely used. Next drug is very, very important for you. That is a recombinant form of growth hormone. And the drug you will write is somatropin. Now this is important. Question comes on this part. Okay, somatropin. We have a new drug also, somatrem. But you have to remember somatropin. How they both are given? They both are given by subcutaneous injection. This is the first MCQ. Somatropin is given by which route? Subcutaneous injection. It cannot be given orally. Next point we will write that. What is the use of somatropin or this growth hormone? We know that growth hormone will increase the height. Hence, it is the drug of choice for the treatment of dwarfism. It is the drug of choice for the treatment of dwarfism. You will write before epiphyseal closure. Do you agree with this point? अगर एपिफाइसिस क्लोज हो जाएंगी तो बोन की लेंथ इंक्रीज नहीं हो सकती. नेक्स्ट पॉइंट वी विल राइट एड्स रिलेटेड कैचेक्सिया. कैचेक्सिया बच्चा मींस वेट लॉस. कैचेक्सिया का मतलब होता है वेट लॉस. सो इट विल हेल्प इन रिस्टोरेशन ऑफ वेट. देन यू विल राइट माल एब्जॉर्प्शन इन शॉर्ट बावल सिंड्रोम. ये क्या चीज है, अभी हम इस पे आएंगे. ओके. लास्टली इट इज ऑल्सो गिवन इन प्रीमेच्योर नियोनेट. वाई? टू रिस्टोरेशन ऑफ बॉडी वेट. For restoration of body weight, just try to remember this part. For a moment, try to remember this part. Beta, if you will give Shrishti ji, if you will give growth hormone relating hormone, if pituitary is not releasing growth hormone, it means there is some defect in pituitary. Let's say there is some cancer. There is postpartum pituitary necrosis known as Sheehan syndrome. You will learn in obs and gynae. So there is some problem with pituitary. Okay. Now, next point we will write is side effects of growth hormone. Growth hormone causes growth. If there is growth of connective tissue, don't you think the nerves will get entrapped? अगर ज़्यादा growth हो जाएगी तो nerves entrap हो जाएंगी because of connective tissue growth. Can you tell me one nerve entrapment which occurs in hand because of entrapment of median nerve? I hope you have learnt in first year. If there is excessive growth of connective tissue, है ना? Then there will be nerve entrapment. Nerve will entrap. Entrapment of nerve in wrist, that nerve is median nerve, will lead to carpal tunnel syndrome. Okay. Now, bachcha log, tell me one point that growth hormone produces hypoglycemia or hyperglycemia. Remember one point, any hormone secreted from pituitary, growth hormone, ACTH, prolactin, they all cause hyperglycemia. That is why you have learnt in general pharma that growth hormone is a physiological antagonist of insulin. Growth hormone causes hyperglycemia. It's an antagonist of insulin. It increases insulin resistance. If you remember diabetes, I have told you, bromocriptine like drug. Next you will write it increase intracranial pressure. Hence, it is contraindicated in head injury. It causes lymphomas. It is contraindicated in cancers. Okay, and due to some uneven growth of leg bones, it may cause slipped capital femoral epiphysis. This part you will learn in orthopedics. Okay, so remember a mnemonic: chills. Okay, now बच्चा लोग, हमने एक ये पॉइंट लिखा था, इस पे सवाल आता है, शॉर्ट बाउल सिंड्रोम. सर, व्हाट डू यू मीन बाय दिस शॉर्ट बाउल सिंड्रोम? सर, दिस इज द होल लेंथ ऑफ large intestine and small intestine. This is small and large intestine. What happens in short bowel syndrome? Due to some reason, you have resected or removed, bowel. Don't make this diagram. You have removed this bowel. Let's say the patient was having colorectal cancer. Okay, patient was having some infection. Because of that reason, you have to remove this bowel. Now the point is, when a person will eat food, what will happen? Can we say because of short length of bowel, there will be incomplete absorption, and because of incomplete absorption, the food will not be absorbed properly. The person will have diarrheas. Why diarrheas? Because of incomplete absorption or malabsorption. Yes or no? Yes. Yes. Agreed? Hence, for short bowel syndrome, we have to increase mucosal growth. We have to increase the mucosal growth of intestine. Because if you will increase the mucosal growth of intestine, the remaining intestine, if there is a good mucosal growth, there will be a very good absorption. Yes. And for that, there are two drugs which are approved. For increase in mucosal growth, we give recombinant form of growth hormone. Agreed? And the second drug which has been approved is recombinant form of glucagon-like peptide 2. This drug is known as somatropin. Bachcha log, if you remember, diabetes. In diabetes, I have told you GLP-1 analog. Remember GLP-1 analog? Glucagon-like peptide 1 analog, which are also known as incretins. Incretins causes insulin release, and those drugs were ending with the word tide. Exenatide, liraglutide, LB-glutide, lixasenatide, semaglutide. Remember? Here we are talking about GLP-2, glucagon-like peptide 2, not 1. GLP-1 was used in diabetes. GLP-2 is used in short bowel syndrome, and that drug is known as teduglutide. This question was asked 2 years back in AIMS और JIPMER एग्जाम. तो यहां पे हम लिख रहे हैं GLP-2, teduglutide. So these two drugs are approved in short bowel syndrome to increase the mucosal growth of remaining bowel, so that there should be better growth. So they are contraindicated in head injury, they are contraindicated in cancer. In head injury already there is increase in intracranial pressure. Why cancer? Because they themselves cause cancer. Okay. So I hope you remember this drug, glutide, liraglutide, GLP-1. Tedu means 2, T for 2, teduglutide 2. Easy. Let's talk about next point. Third drug. Next point, third. So this is teduglutide. So these are the two drugs which are approved in short bowel syndrome. Recombinant form of growth hormone and recombinant form of GLP-2 analog. I hope you know how teduglutide will be given. Tide word आ रहा है तो injection से देंगे. We know this part. We will not write it. Third drug we will write is, you'll write mecasermin rinfabate. mecasermin rinfabate. What is mecasermin? इन वर्ड आ रहा है तो हम जानते हैं recombinant form of IGF-1. rinfabate is IGF binding protein. Okay, so we have made direct IGF. Okay, now what is the use of mecasermin rinfabate? It is given for the treatment of dwarfism, which is resistant to growth hormone. Do you agree with this point? Do you agree with this point? Yes or no? Yes or no? Any problem in this? Cachexia bacha means weight loss, severe weight loss, cachexia. You will slowly and slowly learn these terminologies in your MBBS career. Okay? So, dwarfism resistant to growth hormone, like example, growth hormone receptor defect, growth hormone autoantibodies. If there is formation of antibodies against growth hormone, you cannot give growth hormone. If the receptors, JAK-STAT receptors are defective, you cannot give growth hormone. You have to directly give IGF. So how it is given? Subcutaneous injection. Now sir, it is insulin-like growth factor. Its side effect you will write is hypoglycemia. Growth hormone causes hyperglycemia. IGF causes hypoglycemia. It is insulin-like. So insulin-like will be hypoglycemia. ठीक है? These are one drug. It is a one drug. बच्चा लोग, it's a one drug. So this completes growth hormone-like drug. Now let's talk about growth hormone inhibiting hormones. Growth hormone inhibiting hormones. Now बच्चा लोग, before coming to growth hormone inhibiting hormones, somatostatin and dopamine, you have to remember one point always. Okay, I will tell you a very important point that is related to physiology. I have told you that the first drug is somatostatin and the second drug is dopamine. Now dopamine acts on D2 receptor on pituitary. Okay. Beta, growth hormone itself causes hyperglycemia. It is a catabolic hormone. It produces its anabolic effect because of IGF. Growth hormone खुद catabolic भी होता है. उसका anabolic action और growth promoting action comes because of IGF. Now, somatostatin, you will write, they decrease all hormones. You will write prolactin. सबसे ज्यादा क्या कम होता है? Prolactin. Rest all other hormones like growth hormone, ACTH and TSH. You will write rest all other hormones like ACTH, TSH and growth hormone less of prolactin. ये बच्चा लोग ये बात याद रहेगी. So which hormone causes maximum decrease in prolactin level? Dopamine. Which hormone causes maximum decrease in growth hormone level? The answer will be somatostatin. Yes. Now the point I have to tell you, bachcha log, just think logically and tell me. If I say that, sir, for acromegaly means excessive growth hormone. In the treatment of acromegaly, the preferred drug will be somatostatin or dopamine. Tell me the answer. For acromegaly, the preferred treatment of choice will be somatostatin or dopamine. Tell me the answer for this. For acromegaly, in which growth hormone is high, the drug of choice will be somatostatin. And the second question which comes, in the treatment of prolactinomas, the preferred drug will be dopamine stimulator or dopamine like drugs. ठीक है बच्चा लोग, ये बात समझ आई. So keeping this thing in mind, let's talk about first what are the drugs we have, and then I will tell you the treatment of all the acromegaly, prolactinoma, etc. Okay? चलो पहले बात करते हैं सोमैटोस्टेटिन की. की. You'll write somatostatin. It is a 14 amino acid hormone. Okay? It is a universal inhibitory hormone. Remember, it is not just secreted from hypothalamus, it is secreted virtually from all body cells. It is secreted virtually from all body cells. Battery is low. Okay? And you will write it is secreted, so it is GI type. It decreases cyclic AMP. Last point you will write, it is secreted from delta cells. Okay? But the point we are having out here, that this somatostatin has a very short half-life. Its half-life is very short, just 1 to 2 minutes. Just 1 to 3 minutes you can write, or 1 to 2 minutes. Because of this reason, it is not used. Hence, we have made analogs of somatostatins. Why they are made? Because they are longer acting. Analogs are longer acting. You will write they all are given by injections, and they all will, most of them will end with the word reotide. Most of them will end with the word reotide. Easy हो गया काम. Analog मतलब उसका जैसा ड्रग, उसको मॉडिफाई कर दिया हमने. We have modified it. I hope you must be remember a very famous drug, octreotide. I hope you remember this drug, octreotide, lanreotide, paceriotide, okay, vapriotide. You don't have to remember, you just have to identify them. And the last drug you will write is seglitide. Seglitide. आसान है काम. Seglitide doesn't have reo word. Among them you will write lanreotide is the longest. but the most commonly used drug is, we all know, is octreotide. ठीक है बच्चों? Now octreotide, we will write few points about octreotide. It's a very, very important drug for you. It's a very important drug for you. Why it is known as octreotide? OCT word is coming. It is 8 amino acid. It contains 8 amino acid of somatostatin. First 8 amino acids of somatostatin. Second point, half-life. Sir, 90 minutes. First half-life, 90 minutes. How it is given? By injection. Let's write the uses. And everywhere it will be the drug of choice. Everywhere it will be the drug of choice. And you will write that the mnemonic is ideas. The mnemonic is ideas. ठीक है बच्चा लोग, आसान हो गया ना काम? First, it is the drug of choice in a tumor known as islet cell tumor. Islet cell tumor, they are also known as PNET tumors. What is PNET? PNET stands for, you know, islet cells are present in pancreas, है ना? Islet cell pancreas में होते हैं. PNET will be pancreatic neuroendocrinal tumor. Pancreatic neuroendocrinal tumor like insulinoma, gastrinoma, glucagonoma. Why? Because it will reduce the secretion of gastrin hormone which occurs in Zollinger-Ellison syndrome. सुना है ना gastrinoma का दूसरा नाम Zollinger-Ellison syndrome, glucagonoma, insulinoma, etc. Yes, you'll write it is given for diarrheas, and you will write that it is the drug of choice for secretory diarrhea. Secretory diarrhea which occurs in, can you tell me why secretory diarrhea occurs in carcinoid syndrome? Carcinoid syndrome is a tumor of serotonin containing enterochromaffin cell. Serotonin causes diarrhea. Octreotide somatostatin suppress serotonin production. VIPoma, सुना VIPoma? Vasoactive intestinal peptide, yes. VIP also causes intestinal contraction, है ना? VIPoma. Then you will write secretory diarrhea is also seen in HIV. Secretory diarrhea is also seen in cancer patients. Okay. And the drug of choice for any cause of secretory diarrhea will be octreotide. I will be telling you in GIT in more detail what causes secretory diarrhea. If you remember, I have told you esophageal varices because it constricts esophageal vessels. One more drug I have told you, terlipressin, acromegaly. ओके यहीं तक याद रखो, एस वर्ड याद नहीं करना, आइडिया वर्ड याद रखना है. सॉरी आई ओके, अदरवाइज द थिंग्स विल बिकम मोर कॉम्प्लिकेटेड फॉर यू. यस, नाउ साइड इफेक्ट. बिफोर कमिंग टू साइड इफेक्ट आई वांट टू टेल यू, नाउ वी हैव मेड अ न्यू ड्रग, ल्यूडोटाटेट. ल्यूडोटाटेट. Lutetate contains lutetium. This is lutetium. Dotatate means octreotide, another name. This lutetium emits beta rays and it kills PNET tumors. Okay, This lutetium is a radioisotope which emits beta rays and it kills PNET tumors. ठीक है, डन. Side effect of octreotide. बच्चा लोग, can you tell me that how octreotide causes hypothyroidism? Anyone? बच्चा लोग, how? Because it decreases TSH production. We know this part. How it causes hyper and hypoglycemia? Mainly by decreasing insulin release and glucagon release. And the last point is how it causes gallstones. This question has been asked. Why octreotide causes gallstones? Anyone? Guess मारो बच्चों लोग. Why octreotide causes gallstones? Because it decreases the production of one hormone. It is a inhibitory hormone, cholecystokinin. गॉल ब्लैडर की मोटिलिटी कम हो जाएगी, गॉल ब्लैडर पैरालाइज हो जाएगा, गॉल ब्लैडर विल नॉट कॉन्ट्रैक्ट, बाइल विल एक्यूमुलेट, बाइल विल सुपर सैचुरेट, है ना, एंड बाइल विल फॉर्म द कोलेस्ट्रॉल विच इज प्रेजेंट इन बाइल विल कंडेंस टू फॉर्म और सैचुरेट टू फॉर्म गॉलस्टोन्स. यस, यू आर एब्सोल्युटली राइट मुंतेहा जी. मुंतेहा जी ने सही आंसर दिया है. Okay, very good. I hope it's very simple and logical chapter. Yes, ठीक है बच्चा लोग. चलो नेक्स्ट पे आते हैं. You'll write dopamine agonist. And most of this drug we have already covered. These drugs, they act on D2 receptor and they stimulate them. Okay. Now the drug names you will write is bromocriptine, cabergoline, pergolide, and quinagolide. Yes, it may cause rarely hypoglycemia, but its main effect is hyperglycemia. Why? Because of glucagon. Now bromocriptine, you will write safest in pregnancy. Cabergoline, you will write most potent and most effective. Even in resistant cases of bromocriptine, we can give cabergoline. Pergolide, you will write banned. Why? Cardiac, valvular fibrosis. Cardiac valvular fibrosis. Sir, why? See, as you can see, bachcha log, there is an ERG word here. है ना? All these four drugs are ergot derivative. All these four drugs are ergot derivative, and ergot means ergotism. In ergots, they cause fibrosis of cardiac valvular wall. If you remember, bachcha log, I think these four drugs we have already covered in Parkinson disease. So I will just tell you very fast what are the uses and what are the side effects. Okay, we have already covered these drugs in Parkinson disease. You'll write what is the route. These drugs can be given orally. So the only drug I am telling you which can be given orally is these drugs. Okay. Uses. They are the drug of choice for prolactinomas. They are the drug of choice for prolactinomas. ठीक है बच्चा लोग. Now the drug of choice is cabergoline. What is the drug of choice for prolactinoma? Cabergoline. You know the reason why? But in pregnancy, you know, you will give bromocriptine. Next you will write, okay, quinagolide beta is a new drug which is used. You don't have to write anything about it. याद भी नहीं कर पाओगे, जब रिवीजन का टाइम आएगा ना, इतना ही याद करना है आपने. They are also given to suppress lactation after neonatal death. Lastly, they are also given in Parkinson's disease. ठीक है बच्चा लोग, इजी हो गया. So at least try to remember this part. You know that if you will inhibit prolactin secretion, there will be no lactation because of this reason. Side effect. You'll write same like levodopa. बच्चा लोग, can you tell me the most common side effect of levodopa? The most common side effect of levodopa in CTZ area we have discussed about nausea and vomiting. CTZ area पे होते हैं ना बच्चा लोग. We have already discussed that dopamine causes vasodilatation, so it causes postural hypotension. And if you remember, we know that haloperidol antipsychotic dopamine agonist will be causing psychosis. एंटीसाइकोटिक डोपामिन को ब्लॉक करते थे, ये तो डोपामिन को स्टिमुलेट कर रहा है ना. सो सेम साइड इफेक्ट लाइक लीवोडोपा. यस. नेक्स्ट पॉइंट यू विल राइट दैट दे मे कॉज ergotism. And please refer to Parkinson disease. I have told you everything about ergotism, so you don't have to write them again and again. Okay, you don't have to write them again and again. So we have already discussed these drugs. ठीक है. Third drug you will write is pegvisomant. थर्ड ड्रग बेटा, ये टाइड वर्ड से एंड नहीं हो रहे. यस, ओनली टाइड एंड इन ड्रग एंडिंग दे आर नॉट गिवन ओरली. दे आर नॉट एंडिंग विद अवर टाइड, है ना. तो टाइड और इन वाले ड्रग हम ओरली नहीं देते. ब्रोमोक्रिप्टीन में टाइड और इन वर्ड नहीं आ रहा. नाउ बच्चा लोग, पेग्विसोमांट बड़ा सिंपल सा बात है. सोमा मीन्स ग्रोथ हार्मोन. ANT means receptor antagonist. Okay. PEG, it is pygylated. It is pygylated. Pygylated. बच्चा लोग, आपने पढ़ा होगा एक वर्ड PEG. PEG क्या होता है? पॉली इथाइलिन ग्लाइकॉल. polyethylene glycol. We have attached polyethylene glycol. Okay. Now बच्चा लोग, जैसे हम पेग पीते हैं, हम घर पे पेग पीते हैं ना. अगर नहीं पीते तो यू विल स्टार्ट ड्रिंकिंग आफ्टर 4 and 5 years बिकॉज मोस्ट ऑफ द डॉक्टर्स दे ड्रिंक, है ना. बेस्ट वे टू सोशलाइज, समटाइम्स अ गुड वे टू ओवरकम डिप्रेशन ऑल्सो. ओके, सो सोशलाइजेशन, लोग भाई दोस्त बन जाते हैं, पक्के दोस्त बन जाते हैं, भाई बन जाते हैं, जान दे देते हैं एक दूसरे के लिए. जब पी रहे होते हैं कहते तेरे लिए जान हाजिर है. सुबह सब नॉर्मल हो जाता है. दैट इज अ डिफरेंट थिंग. रिमेंबर, when we attach a peg molecule to any drug, जस्ट लाइक वी हैव पेग द ड्रग विल बिकम लॉन्गर एक्टिंग। हम भी पेग पीते हैं, लॉन्गर एक्टिंग हो जाते हैं ना, बोलते ही रहते हैं बोलते ही रहते हैं। हेंस ड्रग पे भी पेग लगा दिया तो ड्रग भी लॉन्गर एक्टिंग हो जाता है। Okay, because this peg inhibit excretion of drug into the urine, that is the reason you don't have to remember. So peg word लगाना मतलब longer हो जाएगा ड्रग। हम भी peg लगाते हैं, longer हो जाते हैं ना, बोलते जाते हैं बोलते जाते हैं। So any drug which contains peg word, pegylated polyethylene glycol, it makes a drug longer acting। ठीक है बच्चा लोग। Now it is growth hormone receptor blocker, use एक्रोमेगली। अभी हम आते हैं एक्रोमेगली का ट्रीटमेंट में। ठीक है जी। सर एक वर्ड बचा, वीआई, साइड इफेक्ट, विजुअल डिस्टरबेंस। ठीक है, सो पेग वर्ड हो गया, पिगाइलेटेड। ओके, सोमा मीन्स ग्रोथ हार्मोन, एएनटी मतलब एंटागनिस्ट। ठीक है, आसान है याद करना, मुश्किल नहीं है। ओके, हाउ इट इज गिवन, इट इज ऑल्सो गिवन बाय इंजेक्शंस। ओके, नाउ before coming to, so this completes growth hormone and related hormones. Before going further, now I want to tell you the medicine part or the surgery part also. Okay, let's see the treatment of pituitary tumors. Because questions come on this part. Okay, I will write acromegaly. एक्रोमेगली मींस इंक्रीज इन ग्रोथ हार्मोन हो गया है। ग्रोथ हार्मोन सर बहुत ज्यादा है, बहुत ज्यादा हो गया ग्रोथ हार्मोन, प्रॉब्लम है ये तो, है ना। एक्रोमेगली बहुत बड़ी प्रॉब्लम है। नाउ द बेस्ट ट्रीटमेंट इज ट्रांसफिनॉइडल सर्जरी। पढ़ा होगा ईएनटी में राजीव सर की क्लास में, राजीव धवन सर, है ना। सर्जरी कर दो सर, बेस्ट ट्रीटमेंट यही होता है। एग्री? But sir, if you cannot do surgery, then the treatment is octreotide. Not control, add pegvisomant. So this is the drug of choice, pegvisomant. नहीं ठीक हो रहा, add केबरगोलिन। I hope you have understood what is the best treatment. Yes. Second, you will write TSH secreting tumor. Same. Best treatment is transsphenoidal surgery. नहीं ठीक हो रहा, start octreotide. सर प्रोलैक्टिनोमा, सर द बेस्ट ट्रीटमेंट इज केबरगोलिन। नहीं ठीक हो रहा, एड ऑक्ट्रियोटाइड। नहीं ठीक हो रहा, ट्रांसफिनॉइडल सर्जरी। तो सर कहां पे जज्बात बदल गए, कहां पे चीजें उल्टी हो गई? प्रोलैक्टिनोमा में। फॉर प्रोलैक्टिनोमा इवन द ड्रग इज बेटर देन ट्रांसफिनॉइडल सर्जरी बिकॉज दिस केबरगोलिन कॉजेस कंप्लीट रेजोल्यूशन ऑफ प्रोलैक्टिनोमा, खत्म कर देता है इसे बिल्कुल प्रोलैक्टिनोमा को। ठीक है, सो केबरगोलिन इज इवन बेटर देन द बेस्ट ट्रीटमेंट वी हैव इज केबरगोलिन। अच्छा जी, ये एक सवाल आया था पिछले साल। इन प्रोलैक्टिनोमा द बेस्ट ट्रीटमेंट, द फर्स्ट ट्रीटमेंट यू विल ऑलवेज गिव विल बी ट्रांसफिनॉइडल सर्जरी और केबरगोलिन। आंसर इज केबरगोलिन। while in all other tumors you will give you will do the best first and the best treatment is transsphenoidal surgery. ठीक है बच्चा लोग, सर्जरी सर्जरी, अरे यार ये नाक है ना आपकी नाक, दिस इज योर स्फिनॉइड बोन, ऑन दिस स्फिनॉइड बोन यू हैव पिट्यूटरी, नाक से जाएंगे, नाक से जाएंगे, इस बोन को तोड़ेंगे और पिट्यूटरी को निकाल देंगे, है ना, पिट्यूटरी को निकाल देंगे, है ना, कुछ पढ़ा होगा ईएनटी में। स्फिनॉइड बोन के ऊपर जो होता है पिट्यूटरी, पिट्यूटरी इज लोकेटेड ऑन अबव स्फिनॉइड बोन, सेला टर्शिका, बिलो दैट वी हैव स्फिनॉइडल ईयर सेल, यू ब्रेक देम एंड एवरीथिंग, है ना, याद रहोगा यार। अब ट्रांसफिनॉइडल सर्जरी क्या है, स्फिनॉइड बोन, दिस इज स्फिनॉइड बोन बच्चा लोग, यार ये एनटी मत पढ़वाओ यार मुझसे। एंड हियर यू हैव पिट्यूटरी, यू गो बाय दिस पार्ट, दिस इज योर नोज, दिस इज नोज, है ना, नोज, स्फीनोइथमोइडल रिसेस, है ना, सुपीरियर टर्बिनेट, इंफीरियर टर्बिनेट, एवरी टर्बिनेट। चलो ईएनटी में पढ़ना, यहाँ पे नहीं पढ़ना अभी आपको, ठीक है, आगे बात करते हैं। सो दिस इज द ट्रीटमेंट, ओके, दिस इज द ट्रीटमेंट। व्हाट अबाउट सर एसीटीएच सिक्रीटिंग ट्यूमर, ACTH secreting tumors, the best treatment is again transsphenoidal surgery. The best treatment is transsphenoidal surgery, not controlled. Give decrease ACTH production by giving octreotide and paceriotide. Okay, not control. You know that pituitary, it acts on adrenal gland, and adrenal gland secretes glucocorticoid, and glucocorticoid act on receptors. The patient generally suffers from Cushing syndrome. In ACTH secreting tumor, the patient suffers from Cushing syndrome, which I will be telling you today. ठीक है ना, we know that it causes Cushing. Not controlled. Do decrease glucocorticoid production in adrenal. Decrease glucocorticoid production in adrenal glands. This is known as medical adrenalectomy. This is known as medical adrenalectomy. What are the drugs? You will write Make My Trip, Make My Trip. First drug you will write is metotane, aminoglutathione, which antifungal drug decreases corticosteroid synthesis in adrenal gland? Ketoconazole. Ketoconazole decreases glucocorticoid as well as mineralocorticoid production in adrenal gland. Which anesthetic agent decreases production of glucocorticoids in adrenal gland? Etomidate. You will write metirapone. And lastly, trilostat. Among them, you have to remember metotane, etomidate and metirapone. ये वर्ड याद रखना है, ये वर्ड याद रखना है, ठीक है बच्चों लोग। लाओ, here you will write among them the drug of choice is either metotane, और मिटायरापॉन, इन दोनों में से आप ये वाला ड्रग यूज करोगे. Among them, the best drug you will write is metotane and mitirapon. You will write they inhibit 11 beta hydroxylase enzyme. They inhibit 11 beta hydroxylase enzyme required for synthesis of glucocorticoids. Okay. बच्चा लोग, can you tell me now the question which is asked from you? Can you tell me which antifungal drug causes adrenal insufficiency? Insufficiency means adrenal gland is not making corticosteroids. Which anesthetic agent produces its side effect of adrenal insufficiency? So these drugs, their side effect will be, if you are using them normally, they cause adrenal insufficiency. बात समझ आई बच्चा लोग? आसान है ना, लॉजिकल बात है. आप एड्रीनल ग्लैंड को सप्रेस कर रहे हो, सो एड्रीनल ग्लैंड विल प्रोड्यूस एड्रीनल इनसफिशिएंसी. यस, है ना, आसान हो गया. लास्ट पॉइंट इज, द लास्ट ड्रग वी हैव इज नॉट कंट्रोल्ड ब्लॉक glucocorticoid receptors. So this will finish. 11 beta hydroxylase, and this drug you will write is mifepristone. आज पढ़ेंगे इस ड्रग को. The drug is mifepristone. So mifepristone, I will tell you, it's a drug for abortion or contraception. But is mifepristone used in Cushing syndrome? Do we use mifepristone in Cushing syndrome? बच्चा लोग, what is your answer? Do we use mifepristone in Cushing syndrome? Yes, bachcha log, the first drug we always give is octreotide, which is the drug of choice. Not controlled, suppress adrenal, not controlled, block glucocorticoid receptors, है ना? So go in sequence wise. कहानी समझ आ गई? They all are MCQ बच्चा लोग. They all are MCQ in one slide. Pooja is asking me, why adrenal insufficiency? If adrenal gland is not making steroidal hormone, this condition you will call it as adrenal is insufficient to produce corticosteroid. So their side effect will be opposite. What is their action? So sometimes you give ketoconazole as an antifungal drug also. Here you are using to suppress adrenal hormone production, but don't you think when you are using ketoconazole as an antifungal drug, it will suppress adrenal, the person will enter into adrenal insufficiency. And etomidate is a general anesthetic drug, anesthesia wala drug, it will also produce adrenal insufficiency. Yes. बेटा ग्लूकोकॉर्टिकॉइड रिसेप्टर्स स्टेरॉइड है ना, तो स्टेरॉइड सेल के अंदर चला जाता है, सो इट विल हैव इंट्रासाइटोप्लाज्मिक रिसेप्टर. दैट आई विल टेल यू इन कॉर्टिकोस्टेरॉइड. अभी हमने कॉर्टिकोस्टेरॉइड नहीं पढ़ा, राइट नाउ वी हैवंट. ठीक है. सो दिस कंप्लीट्स द ट्रीटमेंट ऑफ पिट्यूटरी ट्यूमर्स. ठीक है. सो लेट्स टॉक अबाउट नाउ, दिस कंप्लीट्स द ग्रोथ हार्मोन एंड रिलेटेड हॉर्मोन्स. ग्रोथ हार्मोन एंड रिलेटेड हॉर्मोन्स. चलो बच्चा लोग आगे बात करते हैं. आगे बात करते हैं. नेक्स्ट इज ACTH hormone and corticosteroid. Now, what is the use of ACTH hormone? Only one use. ACTH hormone is given for the treatment of infantile spasm. कुछ याद आ रहा है? ACTH hormone is given for the treatment of बेटा इट इज ग्लूकोकॉर्टिकॉइड, ग्लूकोकॉर्टिकॉइड रिसेप्टर, सॉरी, यस 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 यस, यू आर एब्सोल्युटली राइट, ठीक बात है, एच लिख दिया तो क्या है, बट वी नो इट इज, वी आर टॉकिंग अबाउट ग्लूकोकॉर्टिकॉइड रिसेप्टर्स, जीसी, है ना? हाँ ठीक है बच्चा लोग, आप ठीक कर लो अपने आप, आपको पता ही है ना? इफ आई हैव रिटन समथिंग डिफरेंट बट यू नो द आंसर, वी आर टॉकिंग अबाउट ग्लूकोकॉर्टिकॉइड, ग्रोथ हार्मोन क्यों लिखेंगे बच्चा लोग? फिर हम यहाँ आगे बात करते हैं. सो दिस इज द ओनली थिंग यू हैव टू रिमेंबर अबाउट ACTH हार्मोन, नथिंग एल्स. What is more important is now these drugs, very very important. Let's everyone make a heading, corticosteroids. Now this is a big chapter. अब एक अलग सा चैप्टर है पूरा हमारा, ठीक है? यस, दिव्यालोक इज राइट. सो बच्चा लोग, लेट्स टॉक अबाउट corticosteroid. So this is a different chapter, we have to learn it. Now why they are known as corticosteroid? The reason is they are steroidal hormone, पहली बात. And why they are known as cortico? Because they are produced from adrenal cortex. Hence corticosteroid. What is their receptor? They act on intracytoplasmic receptor. They act on intracytoplasmic receptor. ठीक है? Now we know that in adrenal, in our body, we have two types of corticosteroid. One is glucocorticoids. So I will be using a term GC for it, and mineralocorticoid. ठीक है? Done. Now what is the endogenous glucocorticoid produced in our body? That is cortisol, which is also known as hydrocortisone. Mineralocorticoid which is produced in our body is aldosterone. Mineralocorticoid is aldosterone. ठीक है बच्चा लोग, सिंपल आसान. यस. One question of physiology which I want to ask you, and then I will explain you that question. Does hydrocortisone has mineralocorticoid activity? Does hydrocortisone or glucocorticoid has mineralocorticoid activity? The answer is yes. Does aldosterone has glucocorticoid activity? The answer is yes. ये थोड़ा बहुत एक दूसरे का काम भी करते हैं. Agreed? So keeping this thing in mind, let's see first what are the drugs we have. Now we will make a table. This table has been taken from KD Tripathi book, and many question comes on this table. Okay, so let's talk about drugs now. Okay, the first drug you will write is hydrocortisone. We know another name of hydrocortisone. You'll write glucocorticoid activity, mineralocorticoid activity. Okay, mineralocorticoid activity, you will write dose, and you will write half-life, duration of action, you can write action. Now I will write certain points out here. You don't have to remember that. Okay, but keeping those numbers, I will ask you certain MCQs which are asked. First point, hydrocortisone is taken as a standard 1:1. Okay, let's write the dose as 20 milligram, and duration of action you will write short. Short means 8 to 12 hours. आसान हो गया, आसान हो गया. Next drug we'll write is just cortisone. 0.8, 0.8. So the dose will be 25 milligram. Why? Why? Because it is less potent. Same shot. ठीक है? Now we will write the drugs which are predominant. Glucocorticoids. First drug we will write is KDT में कुछ और दिया है, देख लेना बच्चा लोग एक बार KDT. ठीक है, prednisolone, prednisone, which is a prodrug, prednisolone, which is the active form. ठीक है, glucocorticoid activity 0.4, 0.8. Okay, so it is 4 times more potent than hydrocortisone. So you have to give 4 times more potent means you have to give 4 times lesser dose. 4 times lesser dose will be 20 by 4, 5 milligram. Okay, next अभी इसको छोड़ते हैं. Similarly, methylprednisolone, methylprednisone and methylprednisolone. You know the funda now. You'll write 5.5. So you have to give, it is 5 times more potent, 20 by 5. The dose will be 4 milligram. The dose will be 4 milligrams. So this question you have to remember, this question you have to remember, it is 5 times more potent. Now you will write that 2 drugs, deflazacort and last drug you will write is triamcinolone. Okay, 3, 5, 0, 0. So 3 will be around 6 milligram, 5 will be 4 milligram. These drugs are intermediate acting. All these drugs are intermediate acting. They act for 12 to 36 hours. They act for up to 12 to 36 hours. Bachcha log, you don't have to remember this table, but this table will solve many of your MCQs. That is why I am explaining you this table. Lastly, you will write betamethasone and dexamethasone. Sir, 25, 0, 0, dose 0.7 milligram, equivalent when you will compare them. Sir, longest acting, more than 36 hours. Chalo, keeping this table in mind, हाँ same ratio है, they both have same ratio. Okay, now keeping this table in mind, tell me the first question which is very commonly asked: which of the following drugs are pure glucocorticoids without any mineralocorticoid activity? First question. Just tell me the number. You don't have to type the name. Just tell me the number. Which of the following drugs are pure glucocorticoid without any mineralocorticoid like action? This is the first MCQ which is asked. Which of the following is our pure glucocorticoid? Remember, these four drugs are pure glucocorticoids. Mark कर लो. These four drugs are pure glucocorticoid 3, 4 and 5. Pure glucocorticoid without any mineralocorticoid like action. Deflazacort, triamcinolone, betamethasone, dexamethasone. First MCQ. ठीक है. Second MCQ. Most potent glucocorticoid and longest acting glucocorticoid. Tell me, sir, which is the most potent? Most potent means which require least dose is known as most potent. You'll write that dexa and betamethasone, they are most potent plus longest acting pure glucocorticoid. This is the second statement you will write in your notes. This is the second statement you will write in your notes. This is an MCQ. This was the first MCQ. What are the list of pure glucocorticoid? And this is the second MCQ. Which of the following glucocorticoid are the most potent, longest acting, and they are also pure glucocorticoid? That is betamethasone and dexamethasone. ठीक है? This is the second MCQ. Third MCQ. Which drug has maximum glucocorticoid to mineralocorticoid activity? कौन से ड्रग की ग्लूकोकॉर्टिकॉइड एक्टिविटी और मिनरलोकॉर्टिकॉइड एक्टिविटी बराबर है और सबसे ज्यादा है? Which drug has maximum glucocorticoid to mineralocorticoid activity? Which drug has maximum glucocorticoid to mineralocorticoid activity? Answer. कौन से ड्रग की मैक्सिमम ग्लूकोकॉर्टिकॉइड और मिनरलोकॉर्टिकॉइड एक्टिविटी है? The answer is hydrocortisone. It is, you will write, maximum glucocorticoid to mineralocorticoid activity. Third MCQ. You will write yourself. Last point. Which of the following is the least potent glucocorticoid? Least potent glucocorticoid. Least potent means सबसे ज्यादा dose. Cortisone is the least potent glucocorticoid. Fourth MCQ. So these are the four MCQs which come very commonly in your exams. अब बात समझ आई? Easy हो गया? So this table you don't have to remember, but from this table MCQ comes commonly. Okay? So if you have some image in your mind, you can make an answer. So maximum glucocorticoid to mineralocorticoid activity, this one. Now बच्चा लोग, what is the, why the examiner is asking you this question? I will tell you the reason. This will tell you the uses of these drugs. बच्चा लोग एक बात बताओ. Just think and tell me. There is a patient in which adrenal glands are not functioning. That means the patient is suffering from adrenal insufficiency. समझ गए वर्ड? Adrenal insufficiency. That means there is no glucocorticoid, there is no mineralocorticoid. Both are not there. Can you tell me, बच्चा लोग, which drug would you like to use in adrenal insufficiency in which the patient is not having endogenous glucocorticoid as well as mineralocorticoid? Tell me the answer. एक patient, no glucocorticoid, no mineralocorticoid. Tell me the best drug for adrenal insufficiency. Can you tell me the drug of choice for adrenal insufficiency? Now you know the answer. Yes, everyone is right now. If the patient is not having glucocorticoid and mineralocorticoid, that condition is known as adrenal insufficiency. The drug of choice will be hydrocortisone. The drug of choice will be hydrocortisone. Yes or no? I will tell you later. Now you know the reason for it. बेटा अगर ग्लूकोकॉर्टिकॉइड एक्टिविटी 1 है तो उसके रिलेशन में मिनरलोकॉर्टिकॉइड एक्टिविटी भी 1 है. वी हैव टेकन एज अ स्टैंडर्ड एंड नाउ वी आर कंपेयरिंग अदर ड्रग्स. हाइड्रोकॉर्टिसोन इज टेकन एज अ स्टैंडर्ड. वी आर कंपेयरिंग अदर ड्रग्स विद हाइड्रोकॉर्टिसोन. ठीक है. नाउ लेट्स कम टू द नेक्स्ट एमसीक्यू. लेट्स राइट द ड्रग्स विच आर प्रिडोमिनेंट मिनरलोकॉर्टिकॉइड. इसी के नीचे लिखेंगे ओनली 3 ड्रग्स. ठीक है. You will write predominant mineralocorticoid. The first one you will write is only 3 drugs. Same GC ratio MC. Okay. GC ratio MC. Okay. First drug you will write is aldosterone. Glucocorticoid activity is 0.3. Mineralocorticoid activity is 3000. Oh. Then fludrocortisone. Glucocorticoid activity 10. Mineralocorticoid activity 150. And lastly you will write DOCA. Deoxy. डोका की फुल फॉर्म देखते हैं, बड़ी इजी है. डी ऑक्सी कॉर्टिकोस्टेरॉन एसीटेट. नाउ 3 MCQ विच कम्स हियर. है ना. नाउ you'll write that this aldosterone is not used because it is not absorbed orally. Fludrocortisone and DOCA. DOCA तो रह गया, DOCA लिख लेते हैं. Glucocorticoid activity 0 and mineralocorticoid activity 100. Now the first MCQ I want to ask you. Which of the following drug is a pure mineralocorticoid with no glucocorticoid activity? First MCQ. Tell me the answer. The answer is DOCA. First is DOCA. I hope it's clear to you. But you will write it is also not given orally. It is not given orally. It can be given sublingually. Now, this is the drug which is given orally. Okay. Second MCQ. Which is the most potent mineralocorticoid? Or you will write maximum mineralocorticoid activity. Aldosterone. Maximum mineralocorticoid activity, aldosterone. Last point. Which mineralocorticoid has maximum glucocorticoid activity? Fludrocortisone. I hope it makes sense to you. I hope it makes sense to you. Now the last MCQ you will write drug of choice as mineralocorticoid replacement. If you have to give mineralocorticoid to your patient, you give fludrocortisone. And this fludrocortisone is the drug of choice for hypotension, because mineralocorticoid they increase blood pressure. Fludrocortisone is the drug of choice for hypotension because mineralocorticoid aldosterone it increases blood pressure. How? I will tell you shortly. Okay? कहानी समझ आ गई? इजी हो गया काम? ठीक है. So keeping this thing in mind, let's discuss this point further down. Let's discuss now this question. Okay, let's talk about बेटा अभी डोज पे आते हैं, बताता हूं मैं आपको सारी चीजें. डोज वैसे आपको याद नहीं करना, यू डोंट हैव टू रिमेंबर द डोज. वेयर द डोज यू हैव टू रिमेंबर, यू हैव टू, आई विल टेल यू दैट पार्ट. लाइक एस्पिरिन, उसकी डोज याद करनी है ना. We discussed aminophylline in asthma. We have to remember the dose. It has been asked. Metformin dose, you have to remember. All drug dose you can't remember and you don't have to remember. ठीक है? Now. Let's talk about. Beta, vasopressor is midodrine, but the first drug you always start is fludrocortisone. Okay, first drug you always start is fludrocortisone. Okay, now let's talk about some physiology. What is the effect of glucocorticoid in body? Okay, what is the effect of glucocorticoid in the body? Okay, now glucocorticoids, they have anti-inflammatory action. Anti-inflammatory action. How? And for anti-inflammatory, the most preferred is prednisone. First, I will tell you how glucocorticoid produces anti-inflammatory action, and then I will tell you the uses also. First, you will write it decreases production of interleukins like interleukin 1, 5, 6, TNF alpha. Okay. It increases the production of interleukin 10. And I have told you in asthma that interleukin 10 is an anti-inflammatory interleukin. Third, it increases the production of lipoxin. You'll write it increases the production of lipocortin, which is also known as annexin. And this annexin inhibit phospholipase A2. Phospholipase A2. Now, what is the function of phospholipase A2? Phospholipase A2 decrease arachidonic acid production. If you inhibit phospholipase A2, arachidonic acid production will reduce. Okay, arachidonic acid will. And lastly, it decreases vascular permeability. It decreases vascular permeability. Okay, let's see certain uses. Keeping this thing in mind, like inflammatory condition, arthritis. Heard about RA, GA and PA? कौन सी आर्थराइटिस आपको लग रहा है? आर्थराइटिस, रियोमेटॉइड आर्थराइटिस, गाउटी आर्थराइटिस, सोरियाटिक आर्थराइटिस, है ना? गुड. ब्रोंकियल एस्थमा, you'll write collagen vascular disease. Okay, collagen vascular disease. Heard about certain collagen vascular disease? SLE, PAN, polyarteritis nodosa, है ना? Granulomatous disease like Wegener's, sarcoidosis. Heard about all these condition बच्चा लोग, है ना? Inflammatory bowel disease like Crohn's disease, ulcerative colitis. ठीक है, okay, and various autoimmune disease also, which I will be telling you. Next, you will write that glucocorticoids, they decrease immunity. They decrease immunity of the body. Very important part. Yes, अभी आते हैं इस पे. Now, they decrease immunity of the body. Why? Because they decrease immunoglobulin production. They decrease immunoglobulin production. They decrease lymphocytic division. Now इसको mark कर लो. They kill lymphocyte. Because of this reason, you will write, but they have no effect on neutrophils. Now, please mark this part that glucocorticoid, they don't kill neutrophil. इनसे neutrophil का level कम नहीं होता, but किसका level कम होता है? Lymphocyte का. And we know that lymphocytes, they produce antibodies. Immunoglobulin, है ना? Immunoglobulin or antibodies are produced by lymphocyte. Okay. Now, because of this reason, they are given in autoimmune disease. Okay. They are also given in lymphomas. Do you agree with this part? Do you agree with this part? That they are used in lymphomas. Like Hodgkin's lymphoma, non-Hodgkin's lymphoma. You'll write AML, CML, CLL, etc. जितने भी आप जानते हो लिख लो सब, है ना? ल्यूकीमिया, लिम्फोमा एक ही बात होती है. आसान हो गया? Why? Because they kill lymphocytes. They kill lymphocytes. ठीक है? Now, third point we will write is, that glucocorticoids, they have anti-emetic action in cancer patient. That I will tell you in cancer. Hence they are given, hence you will write DEXA or betamethasone are used. Okay. DEXA and betamethasone are used. Fourth, okay, just write here also organ transplant. Just write there also, they decrease immunity of the patient, hence they are also given in organ transplant people. Organ transplant people. Okay. Organ transplant people. Next we will write is IBD beta, inflammatory bowel disease, Crohn disease and ulcerative colitis are the two types of inflammatory bowel disease. ठीक है? Now you will write glucocorticoids in infections. बच्चा लोग एक बात बताओ, glucocorticoid, they reduce the immunity of the body. Yes, we know. And if there is decrease in immunity of the body, it will lead to infections. We know this part also. बच्चा लोग, tell me one point that would you like to give glucocorticoid in infections? Would you like to give glucocorticoid in infections? You'll write glucocorticoid, they are mainstay or always given in life threatening infections, they are given in infections. It's a very common misconceptions that glucocorticoid are not given in infection. They are given in infection. Yes, it is given. So remove this misconception that glucocorticoids are not given in infection. Although they reduce immunity of the body, they themselves can cause infection, but still they are given in infection. I'll tell you the reason why. Because in infection there is inflammation, yes, and inflammation can cause fibrosis and edema. इन्फेक्शन में क्या होता है, इन्फ्लेमेशन होती है, एंड यू नो दैट फाइब्रोसिस अकर्स इन इन्फ्लेमेशन इन पैथोलॉजी यू हैव लर्नड, एंड एडिमा. सो ग्लूकोकॉर्टिकॉइड्स दे रिड्यूस फाइब्रोसिस एंड एडिमा. That is why they are given. Okay, but you will write they are always given with antibiotics. Antibiotics के साथ देते हैं. Okay, and you will write they also overcome adrenal insufficiency ड्यू टू स्ट्रेस. इन्फेक्शन में जब स्ट्रेस होता है तो कई बार एड्रीनल ग्लैंड पूरी तरीके से, एड्रीनल ग्लैंड समटाइम्स कैन नॉट मेक सफिशिएंट अमाउंट ऑफ ग्लूकोकॉर्टिकॉइड एंड मिनरलोकॉर्टिकॉइड टू ओवरकम स्ट्रेस. दे आर स्ट्रेस हार्मोन. सो आई टेल यू नाउ सर्टेन इन्फेक्शन. बच्चा जस्ट थिंक लॉजिकली. सपोज देयर इज अ पेशेंट ऑफ मेनिंजाइटिस. Let's say tubercular meningitis, TB meningitis. Don't you think if TB has occurred in meninges, there will be fibrosis and there will be edema? Why the person will die? Because meninges will adhere to each other. Fibrosis हो जाती है, edema हो जाता है, brain compress होता है, and the patient dies because of this reason, meningitis. Don't you think glucocorticoid will be life saving drug in that case? Glucocorticoid will be life saving drug. Yes or no? Yes, because excess of inflammation is also bad for us. ठीक है. Now let's write neurocystic same reason, brain वाला. Okay, you'll write pneumocystis infection in HIV. You don't have to remember them, just I am telling you. Septic shock, lepra reaction, Bell's palsy, because here infection could be dangerous. ठीक है. Adrenal insufficiency. Okay, now what is important is that glucocorticoids, they are absolutely contraindicated. In two infections they should never be given, because in this infection you don't want that fibrosis should be inhibited. यहां पे हम fibrosis चाहते हैं. Glucocorticoids, they are absolutely contraindicated in intestinal TB. Intestinal TB. Why? Sir, TB में, this is intestine, there is TB. You know that there is fibrosis. Sir, if you will give glucocorticoid, they will inhibit fibrosis. Don't you think they will inhibit fibrosis? They will reduce fibrosis. And if fibrosis is reduced, don't you think it will lead to perforation? It will lead to perforation. यहां पे तो फाइब्रोसिस ने बचा के रखा हुआ है, अदरवाइज टीबी का बैक्टीरिया तो परफोरेट कर जाएगा, है ना? यस. सेकेंड यू विल राइट हर्पीस, corneal ulcer, same reason. और कॉर्नियल अल्सर इज ऑल्सो नोन एज केराटाइटिस. कॉर्नियल अल्सर का दूसरा नाम होता है केराटाइटिस. कॉन्ट्रा इंडिकेटेड. These are the two indications. The reason is it causes perforation of cornea and permanent opacification of cornea. Herpes causes permanent okay. So in two infection where you will never give glucocorticoid is intestinal TB. यहाँ पे if you will inhibit fibrosis it will perforate. ठीक है. I hope you have understood. So this is an MCQ. In which infection you will not give glucocorticoid? These two infection. Let's move ahead. Okay. Next point you will write. Next use of glucocorticoid you will write as a replacement therapy in adrenal insufficiency. Replacement in adrenal insufficiency. Remember, in adrenal insufficiency there is decrease in glucocorticoid and mineralocorticoid because adrenal gland is not producing glucocorticoid and mineralocorticoid. What are the causes? The first cause you will write is, what are the causes of adrenal insufficiency? You can write certain causes, okay, like Addison's disease, drugs for medical adrenalectomy, अभी हमने पढ़ा, make my trip, okay, one genetic enzyme deficiency, this condition is known as CAH, congenital adrenal hyperplasia. Congenital adrenal hyperplasia. Okay. Can you tell me the drug of choice? The drug of choice is hydrocortisone. The drug of choice for adrenal insufficiency is hydrocortisone. Why? Because hydrocortisone has best glucocorticoid to mineralocorticoid ratio. Plus, if the patient is having hypotension, then give fludrocortisone. Plus salt. Why salt? Because it is an aldosterone hormone like drug, it will cause sodium retention. Because it is mineralocorticoid, they cause sodium retention from kidney. Remember collecting duct? Remember collecting duct? Yes. Last point we will write, the second last point we will write, corticosteroid in pregnancy. Corticosteroid in pregnancy. First use, congenital adrenal hyperplasia in fetus. Now, बच्चा लोग, this is a question. ये बीमारी आपने पढ़ी है? Have you learnt about this disease in pathology? Yes or no? Have you learnt about this disease in pathology? Fludro is given only if there is hypotension, because hydrocortisone has mineralocorticoid plus glucocorticoid like effect. If still the patient is having hypotension, then we add fludrocortisone. as a mineralocorticoid replacement. बच्चा लोग, have you heard about this disease in pathology? ये पढ़ा है डिजीज के बारे में, yes or no? Sir, what happens in congenital adrenal hyperplasia CAH? What happens in CAH? बच्चा लोग समझो इस बात को. Okay. In here we have some enzyme deficiency. Okay. There is some enzyme deficiency like 11 beta hydroxylase, 21 beta hydroxylase, है ना? Because of this reason, what happens बच्चा लोग? There is decrease in, don't write this diagram, glucocorticoid and mineralocorticoid production in adrenal. There is decrease in glucocorticoid and mineralocorticoid production in liver, in adrenal. सॉल्ट बेटा सोडियम तो दोगे ना, सोडियम को रिटेन भी तो करना है. एल्डोस्टेरॉन नहीं होगा तो सोडियम यूरिन में निकल रहा होगा. ओके, सो बिकॉज ऑफ दिस रीजन व्हाट हैपेंस, देयर आर टू थिंग्स व्हिच हैपेंस. देयर इज इंक्रीज इन ACTH लेवल and this ACTH causes adrenal hypertrophy. And you will write now androgens are synthesized. Because glucocorticoid and mineralocorticoids are not there, their enzymes is defective. Now adrenal gland will synthesize more of androgens or male hormone. Because of this reason, it will lead to the female will be converted into male. So it will lead to hermaphroditism. hermaphroditism, pseudo hermaphroditism. सुना होगा ये बात. मारिया जी, किडनी याद कीजिए. What was the action of aldosterone on collecting duct? Remember collecting duct, aldosterone, ENaC channel, sodium absorption, potassium excretion, more sodium causes, है ना, पढ़ा था मैं. Yes. Now बच्चा लोग, first point, congenital adrenal hyperplasia in fetus. The drug of choice is dexamethasone. Okay. Second point, congenital adrenal hyperplasia in newborn. The drug of choice is hydrocortisone followed by fludrocortisone. Now these are the two different definitions I have written. CAH in fetus, CAH in a child who has born now. इस बात को समझते हैं, इस बात को समझते हैं. बच्चा लोग, टेल मी, if a patient, if a child is born with congenital adrenal hyperplasia, what is the main thing? The patient will be having glucocorticoid and mineralocorticoid deficiency. The person will have adrenal insufficiency. And because of adrenal insufficiency, remember, the child who has just born will not have mineralocorticoid, will not have glucocorticoid. These are essential hormones for our body. They maintain our blood pressure. If the child is not having mineralocorticoid or glucocorticoid, the newborn child will go into hypotension and the child will die. So a newborn is having adrenal insufficiency, which is a very, very dangerous condition. This is the main problem. So you have to give mineralocorticoid and glucocorticoid replacement to your child who has just born. बच्चा, यही तो समझा रहा हूं क्यों डिफरेंट ड्रग देने हैं, यही तो समझा रहा हूं. सुनो इस बात को. जैसे एक चाइल्ड बॉर्न होता है, द चाइल्ड हु हैज जस्ट बॉर्न, देयर इज नो ग्लूकोकॉर्टिकॉइड एंड मिनरलोकॉर्टिकॉइड इन दैट चाइल्ड. That child is not having adrenal hormones. Blood pressure is low because these hormones, they maintain blood pressure. They are essential hormones for our life. That child will, the newborn child will die suddenly because of deficiency of glucocorticoid and mineralocorticoid. Yes, hence you have to treat adrenal insufficiency, and I have already told you the treatment of adrenal insufficiency. I hope this is second point is clear to you. Second point is clear to you, yes or no? Second point is clear to you. Okay, now second point. Now first point पे आते हैं. The child is not born yet. The child is still inside the mother. Fetus है अभी भी. Sir, in fetus, this glucocorticoid and mineralocorticoid, they are supplied through mother. बच्चा hypotension में नहीं जाता. But sir, in a fetus, what is the problem? In fetus, the problem is this high amount of ACTH. This high amount of ACTH is causing adrenal hypertrophy, and this adrenal hypertrophy is causing excessive androgen production. तो फीटस में क्या प्रॉब्लम है? फीटस में प्रॉब्लम है हर्माफ्रोडिटिज्म हो जाएगा. दिस इज द प्रॉब्लम इन फीटस. फीटस में adrenal insufficiency is not the problem because maternal or mother hormones can make the fetus survive. Now बच्चों एक बात बताओ. Can you tell me the most potent glucocorticoid? The most potent glucocorticoid I have told you is dexamethasone. Can you say that dexamethasone will be the best drug? It will be the best drug to suppress ACTH in fetus. It is the best drug because it requires least dose. It's a pure glucocorticoid. It is the best drug to suppress ACTH in fetus. So the problem is in fetus we have to reduce this so that hermaphroditism na ho. Fetus doesn't go into adrenal insufficiency. A newborn child goes into adrenal insufficiency. तो अब now understand here my words. अब मेरी बात सुनो मैं जो कहता हूं. Congenital adrenal hyperplasia in fetus. The main problem is there is increase in ACTH level because of no negative feedback. Increase in ACTH causes adrenal hypertrophy, more production of androgen. Female will change into male. This is the problem in fetus. Because of high ACTH, hermaphroditism. Give that mother dexamethasone. Dexamethasone will enter into the fetus and it will suppress ACTH level. ACTH कम हो जाएगा, हाइपरट्रॉफी कम हो जाएगी, hermaphroditism ठीक हो जाएगा. ठीक है. So in a fetus we give dexamethasone to suppress ACTH. But if the child is born, फीमेल तो मेल में कन्वर्ट हो गई, अब क्या करोगे? कुछ नहीं कर सकते. लेट दैट फीमेल लिव लाइक अ मेल. कोई बात नहीं, हो रही है कोई बात नहीं, अब मेल की तरह जी लेगी. बट द प्रॉब्लम इज द चाइल्ड हु इज जस्ट बॉर्न will not have its own glucocorticoid and mineralocorticoid. Fetus में तो mother दे रहे थे. In the fetus the mother were giving, but a newborn child will not have its own glucocorticoid and mineralocorticoid. The child will be suffering from adrenal insufficiency. The child will go into hypotension and shock. Hence we have to give mineralocorticoid and glucocorticoid replacement in a newborn child. Best drug is hydrocortisone. कहानी समझ आ गई? Fetus is a male, no problem. Problem occurs in female only. So this affects female mainly. Female के साथ प्रॉब्लम आती है, मेल के साथ नहीं आती यहां पे. ठीक है. So CAH in fetus, give dexamethasone to suppress ACTH. CAH in a newborn child, treat like adrenal insufficiency, more dangerous condition. ठीक है. This is all. Done. Last point is diagnostic use. कैसे डायग्नोस करोगे बेटा? एंजाइम्स के लेवल चेक करते हैं हम, ठीक है. वी डू एंजाइम टेस्टिंग, अल्ट्रासाउंड, एंटीनेटल टेस्टिंग. We take out, do amniocentesis, see the DNA, see the enzyme level. That is a complex. Diagnostic use of glucocorticoid. We'll write dexamethasone. Okay. एक बात याद रह गई, एक पॉइंट रह गया. I will give you the break shortly. Let me finish this part, then I'll give you a break. ठीक है बच्चों, समझ लो यार, समझना बहुत जरूरी है. सेकेंड यूज इन प्रेगनेंसी. ग्लूकोकॉर्टिकॉइड्स, they are the drug of choice in premature newborns. Why? Because they increase surfactant production. And surfactant production is required for maturation of lungs. They are the drug of choice in premature. If a child is born before 36 weeks, the lungs of the child is not formed properly. Okay. Followed by fludrocortisone. Fludrocortisone बच्चा अभी लिखा तो है. Now the drug you can use is dexamethasone. In India, the drug of choice is dexamethasone. The second drug you can use is betamethasone. In India, the drug of choice is dexamethasone. What is the dose? I am telling you the dose now. This dose you have to remember. Okay, this dose you have to remember. Okay, you will write 6 milligram 12 hourly, 4 doses. Okay, intramuscularly beta 12 milligram 24 hourly, total 2 doses. एक आज देंगे, कल देंगे. इंट्रामस्कुलरली टू द मदर. ओके, टू द मदर एंड देन वी विल इंड्यूस डिलीवरी. पहले मदर को देंगे, फिर हम डिलीवरी को इंड्यूस कर देंगे. इफ अ मदर कम्स टू यू विद लेबर पेन, लेट्स से एट 32 वीक्स, फटाफट मदर को इंजेक्शंस देंगे. That steroid in the mother will go to the fetus. It will cause surfactant production. Then we will induce the labor. Okay, so that is given to mother. Done. Last is diagnostic use. बच्चा लोग, can you tell me which glucocorticoid is most potent, which will give best negative feedback on ACTH? Which glucocorticoid will be the best glucocorticoid to give negative feedback on ACTH? Is it hydrocortisone or is it dexamethasone? कौन सा ग्लूकोकॉर्टिकॉइड बहुत ही कम डोज में आप यूज करेंगे और बेस्ट ACTH को नेगेटिव फीडबैक से सप्रेस कर देगा? Hydrocortisone or dexamethasone? What should your answer? Yes, dexa. So this dexamethasone, there is a test known as dexamethasone suppression test, which you will learn in pathology. This test is given to decrease ACTH for diagnosis of Cushing syndrome. How it is done, you will learn in pathology, not the part of pharmacology. And you know now why dexamethasone is used, because it is the most potent pure glucocorticoid. Glucocorticoids, they give negative feedback to ACTH. Yes, you know the reason why. Okay, next point you will write topical glucocorticoids. Topical glucocorticoids. First point we will write that ointment, okay, ointment, cream, lotion and spray. These are the four methods by which we give. Now ointment means it has maximum lipid content or oily. Because of this reason it will have maximum penetration. Hence ointment are most potent. They require least dose. Okay, they require least dose. दे रहे हैं बच्चे, ब्रेक दे रहे हैं, 2 मिनट रुको, ब्रेक दे रहा हूं यार. You'll write where ointment is given. It is given for dry and scaly skin. Lotion and cream, they have more of water content. More of water content. And you will write they can be given for exudative condition or pus forming lesion. The reason is they may evaporate. After some times they will evaporate. Sprays given for hairy, where hairy areas. So this is first MCQ. Ointment is more potent. Let's see the most potent topical glucocorticoids. What are those drugs? You will write they are 4 drugs. 4 drugs are the most potent topical glucocorticoid. Okay. You'll write first one betamethasone. Betamethasone dipropionate. How much? 0.05% in special vehicle. Second, clobetazole propionate. 0.05%. Third, halobetazole propionate. 0.05%. Ointment, cream, whatever you want to give. And lastly, diflorazone diacetate. 0.05%. Now why I am telling you this part, this question has been asked 2 or 3 times in your entrance exams. Now बच्चों क्वेश्चन क्या आया था इस बात को समझते हैं. See, the question which came in your entrance exam, many people have still answering that question as a wrong answer. Question was, suniye, which of the following is the most potent topical glucocorticoid? This was the question. Which of the following is the most potent topical glucocorticoid? And the option was having this, betamethasone dipropionate, ये ऑप्शन दिया हुआ था. एंड द सेकेंड ऑप्शन दैट वाज गिवन वाज दिस. ये दोनों ऑप्शन दिए हुए थे. ठीक है. Both options were given and the question was asking which of the following is the most potent topical glucocorticoid. Tell me the answer. If both options are given, which options you will mark? 1 or 2? Which option you will mark? 1 or 2 if both are given? Guess maro. Diflorazone diacetate. Guess. If both 1 and 2 are given, then you will go by, both 1 and 2 are given, you will go by this answer. Why? Because in that question, this word was not given. In that question, which of the following is the most potent topical glucocorticoid? They have only mentioned betamethasone dipropionate 0.05%. Special vehicle word was not given. Okay. Other molecules do not require any special mechanism or special delivery system. Only betamethasone requires special delivery system. If this special vehicle or delivery system is not written, then betamethasone is not the most potent topical glucocorticoid. Okay? Yes. So it requires some special delivery system. That delivery system you don't have to go into that detail. Okay? क्या होता है वो नहीं जाना हमें. But this word was not written. In that case, you will go by clobetasol propionate. कहानी समझ आ गई है ना? अच्छी लगी? चलो, let's take a break, and after the break I will tell you about the side effect of glucocorticoid and mineralocorticoid, that is Cushing syndrome. So after the break we will start with adverse effect of corticosteroids. Okay, and that adverse effect we will discuss is Cushing syndrome. Special vehicle. ठीक है? Done? Yes, if special vehicle is given, then they all four are equal. They all four are equally potent if the special vehicle word is given with betamethasone. If special vehicle is not given, then betamethasone is not the most potent. And all four options will not be asked together in your MCQ exam. They will just ask one of the following. Okay, one of the following they will ask. So let's take a break. 10 minutes break बेटा, इससे ज़्यादा तो हम ले ही नहीं सकते, अफोर्ड ही नहीं कर सकते, है ना? तो इतना ही लेंगे. Yes बेटा, steroids are given in fungal infection to reduce itching, inflammation. पढ़ेंगे हम एंटी फंगल में, है ना? इन्फ्लेमेशन को कम करने. 10 minutes. So right now we are having 11:10. We'll start at 11:20. Very simple. Okay. Now just remember 2 points. The Cushing syndrome. What are the features of Cushing syndrome? For that, write a mnemonic: corticosteroids. This is the mnemonic. Okay, so this is the mnemonic of Cushing syndrome. But before I will tell you each and every clinical feature, how the patient will present. There are certain changes in the body. Just remember one point in your mind and tell me the answer for this. What do you think that these glucocorticoids, they are anabolic hormone or catabolic hormone? Tell me बच्चों, that glucocorticoids are anabolic or catabolic hormone? Tell me this point. Remember, glucocorticoids, they are catabolic hormone. They are produced under stress. Catabolism means everything will break down and those molecules will come into the blood. है ना? चलो. Keeping this thing in mind, they are catabolic. Insulin was anabolic. So let's write the features of Cushing syndrome. First, C stands for Cushingoid features. Now why the Cushingoid features come, I will tell you, but first you will write Cushingoid features are moon-like faces, moon-like faces. You will write second point, buffalo hump, and orange on stick appearance. Now what is this? Let's wait for a moment. Let's wait for a moment. O for, they may cause edema or fluid retention. They are given for the treatment of edema, but they themselves can cause fluid retention. Why? Because, sorry, just a moment, please don't write this. I will come to this edema part shortly. O for you will write, O for you will write, can we say that they will cause catabolic hormone? They will destroy bone. As they will destroy bone, they will cause osteoporosis. They will destroy bone. Why? You will write, they will cause collagen breakdown. ठीक है, collagen breakdown in the bone. Third, you will write, they cause redistribution of fat. Also known as lipodystrophy. Now what does it mean? Let's understand. The fat will break down in limbs. Hence the limb will become very thin. Limb will become thin, and this fat will deposit in. This fat from the limbs will be broken down, and this fat will deposit in face, between scapula, and abdomen. This fat will now from the limbs, it will be broken down, it will deposit on face, moon-like faces, interscapular area, hump, central obesity, orange on stick appearance. ठीक है, कहानी समझ आई? T for, on skin, if there is collagen breakdown, can we say that skin will become thin? Because of collagen breakdown on skin, and this thinning of skin will lead to telangiectasia. The blood vessels will appear more prominent. Okay, and okay, easy bruisability. The skin will be easily damaged because the skin is broken down. I, they cause infections. You know they cause infections, but they are still given in infections. Like I have told you, inhaled corticosteroid candida infection, है ना? Cortico C, they cause cataract. Which cataract? You will write posterior subcapsular cataract. On systemic use like oral and IV, and you will write they cause glaucoma on topical eye drops. Topical eye drops of glucocorticoid, they cause glaucoma. They block outflow of you. Okay, then you will write they cause osteonecrosis of femur, which is also known as avascular necrosis. Because they are catabolic hormone, they decrease blood supply to bone. Okay. Corticosteroid, they cause stress, peptic ulcer. Reason, they decrease COX enzyme, decreases PGE2 in stomach. I hope you remember. COX enzyme is produced from arachidonic acid. Arachidonic acid produces PGE2. Then to make a mnemonic, I'm again using the word telangiectasia. Okay. Now, in brain, they cause euphoria, very good feeling, and psychosis. Now, बच्चों एक बात सब याद रखना. Yes, चांद सा मुखड़ा, moon like faces. Now, remember one point. हमारे देश में बहुत सारे बिना डिग्री के डॉक्टर बैठे हुए हैं, है ना. देयर आर मेनी डॉक्टर्स विदाउट एनी डिग्री, and there are many doctors who are in Ayurveda, homeopathy, who doesn't know their field. होता क्या है, स्पेशली इन रूरल एरियाज, आदमी को कोई भी बीमारी होती है, एनी डिजीज, they go to a crooked doctor who doesn't know anything. They very commonly prescribe some white powder, commonly given in homeopathy also. White powder, they give some white powder to each and every disease. That white powder is generally this glucocorticoid or corticosteroid. Suppose the patient is having some disease, patient is feeling uneasy because of inflammation, there is fever, pain, etc. They prescribe glucocorticoid. Now we know that glucocorticoids, they are very much powerful anti-inflammatory molecule. Because of anti-inflammatory action, the patient will have loss of all symptoms of inflammation. सारे inflammation के symptoms खत्म हो जाएंगे. पेशेंट को बहुत अच्छा लगेगा. क्यों अच्छा लगेगा सर? इन्फ्लेमेशन नहीं हो रही, पेन गया, फीवर गया. एग्रीड? पेशेंट विल फील वेरी गुड. सो दे विल प्रोड्यूस अ यूफोरिक इफेक्ट, वेरी गुड इफेक्ट. कहेगा डॉक्टर साहब ने तो एक दवाई दी, एक दिन में ठीक हो गया. बट सर, इन्फ्लेमेशन इज अ टू एज स्वॉर्ड. वो अगर हमारी बॉडी में बैड सिम्टम्स प्रोड्यूस करती है, बट दैट सेम इन्फ्लेमेशन protect us from infection. That same inflammation protects us. It's an immunity of our body. Don't you think? पहले तो आदमी सिम्टोमेटिकली ठीक हो जाएगा, पर अंदर का इंफेक्शन बढ़ता जाएगा, बढ़ता जाएगा, बढ़ता जाएगा. 2 दिन पेशेंट तो बहुत अच्छा रहेगा. Third day the patient will just land in emergency in last stage of the disease and the patient will die suddenly. है ना? ऐसा ही होगा ना, क्योंकि इन्फ्लेमेशन हो ही नहीं रही, डिजीज स्प्रेड कर रहा है. इन्फ्लेमेशन नहीं हो रही, सिम्टम्स अच्छे हो गए, सिम्टम्स तो ठीक हो गए, पर डिजीज बढ़ गया. ये होता है स्टेरॉइड के साथ. इसीलिए बिना डिग्री के डॉक्टर के पास नहीं जाना. 2-3 दिन तो ठीक कर देगा, इन्फ्लेमेशन के साइन चले जाएंगे, बट बाद में इमरजेंसी में लैंड करेंगे और उसके रिलेटिव्स, दोस्त रिलेटिव्स ऑफ द पेशेंट विल बीट यू. दे विल बीट यू लाइक दिस. यस, आगे बात करते हैं. They retard growth because they are catabolic hormone. Okay, and they will cause muscle damage. Why? Because the muscles, they are catabolic hormone, they will destroy muscles. Myopathy will occur. Okay, then they will cause low potassium and they increase sodium. Increase in sodium causes hypertension and edema. These two actions are because of mineralocorticoid action. They are absolutely contraindicated in diabetes mellitus. Why? Let's understand this part. Sir, muscle damage हुई, अमाइनो एसिड बना, amino acid will come into the blood. Sir, collagen breakdown occurred. कहीं पढ़ा था collagen breakdown? कोलेजन ब्रेकडाउन भी कहीं पढ़ा था स्किन में, है ना? कोलेजन ब्रेकडाउन, bone breakdown, amino acids will be produced. Those amino acids will go to the liver, and in liver there will be gluconeogenesis. Glucocorticoids, they increase gluconeogenesis in liver, which will lead to hyperglycemia. Hence, why glucocorticoid, they are contraindicated? They produce hyperglycemia because of increase gluconeogenesis in liver. Can you tell me one drug which was inhibiting hepatic gluconeogenesis, was the drug of choice for type 2 diabetes mellitus? Can you tell me that drug which was inhibiting that? Can you tell me which drug was inhibiting hepatic gluconeogenesis and was the drug of choice for type 2 diabetes mellitus? That drug was metformin. Metformin inhibit करता है gluconeogenesis. Glucocorticoids, they promote gluconeogenesis. Hence they cause hyperglycemia. More glucose will be produced. Okay? Yes. Lastly, glucocorticoids, they suppress ACTH by negative feedback. Okay? Now, what is the importance of this point? I will tell you now shortly. थोड़ी देर में बताता हूं इसकी importance, suppression of ACTH. Now, just write one point that glucocorticoids, they increase gluconeogenesis and hence they cause hyperglycemia. While glucagon hormone, it causes glycogen breakdown, glycogenolysis, and it causes hyperglycemia. And they both are contraindicated in diabetes mellitus. They both are contraindicated in diabetes mellitus. Now, let's talk about this point, suppression of ACTH. Suppression of ACTH. Leave beta 1 or 2 pages. Okay. Now you will write that chronic usage of steroid usage, that is 5 milligram of prednisolone or equivalent of other drugs, if given for more than 2 weeks, causes decrease in ACTH level in the body. They decrease ACTH level in the body. What is the problem? Now, if you stop steroids suddenly, what will happen? The patient will go into adrenal insufficiency. I hope you have understood the meaning. And the patient will go into shock. Blood pressure maintain नहीं हो पाएगा. Beta, those steroids, Sanjeev ji, they are known as anabolic steroid. Those steroids which are taken by bodybuilders are not glucocorticoid, they are catabolic hormone. Those steroids are known as anabolic steroid, and those are the derivative of testosterone hormone. Glucocorticoid are catabolic steroid, testosterones are anabolic steroid. ठीक है बच्चों, संजीव जी, Your answer is clear now. Glucocorticoids are catabolic steroid. Testosterone I will be telling you after this only, anabolic steroid. तो बॉडी बिल्डर जो होते हैं वो टेस्टोस्टेरोन वाला लेते हैं, ग्लूकोकॉर्टिकॉइड वाला नहीं लेते, वो तो और पतले हो जाएंगे, फिर तो बॉडी बिल्डर के बजाय मिस इंडिया बन जाएंगे. इंस्टेड ऑफ बिकमिंग बॉडी बिल्डर, इफ दे आर टेकिंग ग्लूकोकॉर्टिकॉइड, दे विल बिकम मिस इंडिया, है ना. सो बिकॉज ऑफ दिस रीजन, corticosteroids, they are always tapered gradually. They are never stopped suddenly. They are never stopped suddenly. ठीक है. ओके. यस बेटा, यस यस यस. बट बेटा स्ट्रेस में ग्लूकोकॉर्टिकॉइड काम करते हैं, और ग्लूकोकॉर्टिकॉइड ड्यूरिंग स्ट्रेस दे मेंटेन ब्लड प्रेशर, दे हैव मिनरलोकॉर्टिकॉइड लाइक एक्शन, है ना. नाउ हाउ वी कैन प्रिवेंट इट. फर्स्ट, okay, how to prevent it, the first. The second thing, how we can prevent it, give pulse therapy of corticosteroid. Advantage, no ACTH suppression. Give pulse therapy of corticosteroid, no ACTH suppression. Now what is pulse therapy? Pulse therapy means alternative day corticosteroid. आज दिया, नेक्स्ट डे नहीं दिया, देन दिया, थर्ड डे दिया, चौथे दिन नहीं दिया, पांचवें दिन दिया, छठे दिन नहीं दिया. ऑल्टरनेटिव डे में अब हम कॉर्टिकोस्टेरॉइड देंगे. इफ यू विल गिव कॉर्टिकोस्टेरॉइड ऑन ऑल्टरनेटिव डे, व्हाट विल हैपन? ड्यूरिंग दिस डे, व्हेन यू आर नॉट गिविंग कॉर्टिकोस्टेरॉइड, देयर विल बी रिबाउंड, इंक्रीज इन ACTH. जब आप नेक्स्ट डे कॉर्टिकोस्टेरॉइड नहीं देते, तो बीच बीच में ACTH दोबारा वापस आ जाता है. डू यू एग्री विद दिस पॉइंट? एंड द ड्रग ऑफ चॉइस एज अ पल्स डे थेरेपी इज मिथाइलप्रेडनिसोलोन. The drug of choice is methylprednisolone. And the last point you will write, among pulse therapy never given. बच्चों tell me the reason. Betamethasone and dexamethasone. Which corticosteroid are never given as a pulse therapy? बच्चा लोग, can you tell me the reason for it? I hope you know the answer for this. बच्चा लोग, tell me the reason for this. Why in pulse therapy or alternative day therapy, betamethasone and dexamethasone are not given? Because they are longest acting drug. They act for more than 36 hours. अगर इनकी एक डोज दोगे, ये 3 दिन तक, 1.5 दिन तक या 2 दिन तक काम करते रहते हैं. बीच में इनको देने के बाद भी देयर विल बी प्रोलॉन्ग्ड ACTH सप्रेशन. यस यस, MCQ हुआ है, MCQ है. ठीक है बच्चों, दिस कंप्लीट्स योर कॉर्टिकोस्टेरॉइड. नाउ यू नो द रीजन फॉर ईच एंड एवरीथिंग. पल्स थेरेपी मतलब आज दिया, पल्स होता है ना, आज दिया फिर नहीं दिया. पल्स भी ऐसे ही आती है ना, सडनली आती है फिर नहीं आती. पल्स मींस इंटरमिटेंट डोज. नेक्स्ट डे वी विल स्किप, सो दैट इन बिटवीन ACTH लेवल दोबारा वापस आ जाए, फीडबैक नहीं जाएगा. डन? गुड गुड. let's talk about now let's talk about now the next topic, gonadotropins and related hormones. ओके, रिबाउंड मतलब दोबारा से वापस आ जाएगा. रिबाउंड मतलब इट विल कम बैक टू द नॉर्मल अगेन. नाउ गोनाडोट्रोपिन्स एंड रिलेटेड हार्मोन, वेरी सिंपल बच्चों, वेरी सिंपल, वेरी सिंपल. सर लेट्स मेक हाइपोथैलेमस, लेट्स मेक पिट्यूटरी. I am for gonadotrophins, I am using the word GN. I am using the word GN. We know that pituitary forms gonadotropins. And there are two types of gonadotropins produced by the pituitary: FSH, LH. Beta, steroid sparing action I will tell you when we will discuss immunosuppressive drug like azathioprine like drugs. ठीक है, तब बताऊंगा आपको मैं, अभी कोई लॉजिक नहीं है. Steroid sparing in one word means that those drug will not produce Cushing syndrome. That is steroid sparing. Steroid sparing means Cushing syndrome नहीं होता. ठीक है, steroid sparing means that means Cushing syndrome नहीं होगा. As simple as that, है ना, मुश्किल थोड़ी ना है. Now the point you have to remember is which hormone stimulates the release. The hormone which stimulates the release of gonadotropin, let's call it as GnRH. GnRH. ठीक है, GnRH. Next point, just a moment, just a second. Yeah. Can you tell me which hormone inhibit the secretion of GnR? Can you tell me which hormone will inhibit? Again we will write GnRH. ये क्या लिख दिया सर ने? ये तो गड़बड़ हो गई, ये तो गड़बड़ हो गई, ये तो गड़बड़ हो गई कुछ. इसका मतलब क्या है? इसका मतलब सर कुछ नहीं है, बहुत सिंपल सी थिंग है. That same hormone can increase or decrease the release of gonadotropin releasing hormone. Now let's understand this part. If this gonadotropin is released in this fashion, you'll write intermittent and pulsatile release. Will stimulate the release of FSH and LH. Okay, it will increase the release of gonadotropin. But if this same gonadotropins you are giving in continuous and in high dose, you'll write after 1 week there is desensitization of GnRH receptors on pituitary. Hence they will decrease now. I hope you have understood this simple logic and simple point. I hope you have understood this part. Not negative feedback. Remember, if you give gonadotropin releasing hormone continuously to your patient, the receptor will stop responding. Receptor कुछ टाइम के बाद रिस्पॉन्ड करना बंद कर देंगे and there will be decrease in release of gonadotropins from pituitary. है ना, सिंपल सी बात हो गई. Yes, we know this part. Yes, है ना, सिंपल सी बात. Now, what is the function of this FSH in males and females? Spermatogenesis. And LH causes testosterone production. Spermatogenesis. In female, it causes formation of Graafian follicle. And the cells, the outer cells of Graafian follicle, they release estrogen. LH causes ovulation. And after ovulation, corpus luteum is there. And corpus luteum produces progesterone. As simple as that. है ना? Yes, Kishanji, it is like beta arrestin. But there are many reasons for desensitization of receptor. One is beta arrestin. You will learn in general pharma, not a part here. I hope the concepts are clear. So this physiological concept is very simple. Physiology. Now let's talk about drugs. Let's talk about drugs now. The first drug you will write is recombinant form of GnRH, gonadotropin releasing hormone. The drug name is gonadorelin. Sir, inward is coming. Subcutaneous injections. Oh, subcutaneous injection, inward is coming. Okay. Now, it is not used because it is least potent and short acting. Not used. Hence, now we have made super active gonadotropin releasing hormone analogs. Analogs means milte julte drugs. These drugs are more than 100 times more potent. They are 100 times more potent than gonadorelin. Okay. So we use these drugs. Let's write the names of these drugs. So you will write first goserelin, hystrelin, buserelin, leuprolide, okay, triptorelin, and the last drug you will write is nafarelin. Now bachcha log, how to remember their names? You are seeing that these drugs are ending with the word relin. And the only exception is leuprolide. Leuprolide is an exception. It is not ending with the word relin. And the most commonly asked name is leuprolide from you. आपसे कौन सा पूछा जाता है? ल्यूप्रोलाइड पूछा जाता है. ओके, ल्यूप्रोलाइड पूछा जाता है. ठीक. What is the root? Again, relin word not given orally. We know this part. Let's see their root. These drugs are given as a subcutaneous implant. This drug is given as an intramuscular depot injection, and a leuprolide can be given by both routes. Nafarelin intranasal spray. Nafarelin intranasal spray. ठीक है बच्चों, simple. Let's talk about their uses. Now, this is a very important point. This is a very commonly asked question. Okay, this is a very commonly asked question. Done. रेलिन बेटा एक तरीका है याद करने का, रिलीजिंग है ना, रिलीज कर रहे हैं, रिलीजिंग हार्मोन है ना. So how to identify these drugs? That is why I am telling you they are ending with the word renin. Now just see this part. Can we say that uses of gonadotropin depends upon if you are giving them pulsatile injection or you are giving them as a continuous injections or implant? When you are giving them as pulsatile injection, they will increase FSH and LH. No, they are not given orally. याद रख लो इस बात को. And they will decrease FSH and LH. Yes or no? Have you understood this point? Now, have you understood this point? Yes. Let's see. They are drug of choice for, you will write, for delayed puberty. Azoospermia, because they will induce spermatogenesis. Anovulation. Hence, they are given for the treatment of infertility. They are given for the treatment of infertility. Next, they are the drug of choice for precocious puberty. Second, they are the drug of choice for prostate cancer. बच्चा लोग prostate cancer में drug of choice क्यों है? Because they decrease testosterone production. Okay. Third, they are given in endometriosis. They are given in leiomyoma. Just a second. Yeah. They are given in breast cancer. Okay. Why? Because they decrease estrogen production. But they are drug of choice here only. Drug of choice यही है. आसान हो गया काम? Yes. बेटा बीटा एरिस्टिन को भूल जाओ यार, अभी जो पढ़ा रहे हैं उस पर ध्यान दो. अभी क्या है बीटा एरिस्टिन, सब बीटा एरिस्टिन पे जा रहे हो. आज तक कोई क्वेश्चन नहीं आया बीटा एरिस्टिन पे. छोड़ दो बीटा एरिस्टिन थोड़ी देर, उसको एरिस्ट रहने दो. बेटा जी एरिस्टिन को भूल जाओ. ओके ओके. Okay. Now, what is their side effect on continuous administration? First, you will write they cause initial flare up reaction. That means in initial 1 week, they rather increase FSH and LH, which will lead to flare up of cancer growth. Prostate cancer growth. Okay, they can flare up prostate cancer growth. Yes or no? Have you understood this point? Have you understood this point? Have you understood this point? Beta, leuprolide till now is not available as an intranasal formulation. अभी तक अप्रूव नहीं है. Okay. So this is their drawback. In initially they will increase FSH and LH. After that they will decrease FSH and LH because of desensitization of receptors. ठीक है. Second point, you will write they decrease estrogen. Because of this reason, they cause osteoporosis, hot flushes, and depression. Don't you think when the level of estrogen reduces in a post-menopausal female, estrogen is good for bone? These are the post-menopausal symptoms. Hence, they are contraindicated beyond 6 months because of the risk of osteoporosis. And remember that these things occur in both male and female. ये जो साइड इफेक्ट है ना, सिर्फ फीमेल्स में नहीं होते, मेल्स में भी ईस्ट्रोजन होता है. ओके, एंड दिस साइड इफेक्ट अकर्स इन बोथ मेल एंड फीमेल. मेल्स में भी ईस्ट्रोजन ही बोन की ग्रोथ के लिए इंपॉर्टेंट होता है. Okay, first use was precocious puberty, second use was prostate cancer. In those cases, they are the drug of choice. Now, to overcome this effect, now we have made gonadotropin releasing hormone receptor antagonist. Gonadotropin releasing hormone receptor antagonist. Yes, lack of estrogen causes depression. Estrogen deficiency causes depression. Postmenopausal females में होता है. ठीक है. Now these drugs, they will only block GnRH receptor. Hence, they will only decrease FSH and LH. Advantage: no initial flare up reaction or no initial increase in FSH and LH. Estrogen acts on vasomotor center of our brain and it maintains vessel tone. Lack of estrogen, vasomotor center, hot flushes, vessels will dilate. Now, what are the drugs? You will write ganirelix, citrorelix, digarelix, and abarelix. So I hope now you have understood they are ending with the word relics. They are ending with the word relics. आसान है. They are ending with the word relics. Okay, so they are also given by injections. So they are ending with the word relics. ऊपर वाले रेलिन या relics. Use prostate cancer. Okay, prostate cancer. And they are also used in vitro fertilization. Okay, there is a new drug. Elagolix. It is given for the treatment of endometriosis. पेन होता है एंडोमेट्रियोसिस में. ठीक है. So this completes gonadotropin releasing hormone. Next one we will write is gonadotropins. Next we will write as gonadotropins. Now, what are the drugs which are available? Not very important topic. This topic is not very important. So we will write just 4-5 points about this gonadotropins. Okay. ROA क्या होता है प्रशांत जी? इन विट्रो फर्टिलाइजेशन प्रोसीजर. आर्टिफिशियल है ना, टेस्ट ट्यूब बेबी वहां यूज करते हैं. एंडोजेनस गोनाडोट्रोफिन को ब्लॉक कर देते हैं हम उनमें, हम बाहर से देते हैं. ठीक है. नाउ ड्रग्स. फर्स्ट यू विल राइट कॉम्बिनेशन ऑफ FSH प्लस LH. दिस इज नोन एज ह्यूमन menopausal gonadotropin. Why? Because they are obtained from urine of postmenopausal female. बच्चा लोग एक बात बताओ. In a postmenopausal female, can we say ovaries are not functioning? Ovaries are not functioning in postmenopausal female. Can we say there will be decrease in estrogen and progesterone? This decrease in estrogen and progesterone will increase gonadotropin level. कोई negative feedback नहीं जाएगा. High level of gonadotropins are seen in postmenopausal female. Okay. Next we will write FSH. First you will write urofolitropin. Use urine of postmenopausal female. And folitropin alpha या beta. This is recombinant form of FSH. This is recombinant form of FSH. Yes बेटा, then we give outside से हम हार्मोन देते हैं controlled way में. Okay. Then you will write, what are the third you will write? Third we will write, okay, LH, lutropin alpha, recombinant form of LH hormone. And the fourth one you will write is beta HCG. Now, beta HCG is human gonadotropin. You'll write beta HCG is like LH hormone. It is obtained from urine of pregnant females. It is obtained from urine of pregnant females. Why? Choreo means it is synthesized from placenta. I hope you have understood this meaning. Very simple and easy. है ना, आसान हो गया ना? Uses of all these drugs. In females, they are used for in vitro fertilization. अब बच्चों होता क्या है, इन विट्रो फर्टिलाइजेशन में और टेस्ट आर्टिफिशियल बेबी में, इन अ फीमेल वी रिड्यूस द प्रोडक्शन ऑफ endogenous FSH and LH. How we can reduce the production of endogenous FSH and LH? By blocking endogenous gonadotropin releasing hormone. तो एंडोजेनस गोनाडोट्रोफिन रिलीजिंग हार्मोन को ब्लॉक कर देंगे, एंडोजेनस एफएसएच और एलएच ब्लॉक हो जाएगा. डू यू एग्री? नाउ वी विल गिव दिस एफएसएच एंड एलएच फ्रॉम आउटसाइड, अपने हिसाब से अब हम देंगे. ओके, after that blocking endogenous FSH and LH by giving GnRH hormone analog that will reduce the production of endogenous FSH and LH. Now we will give these drugs to artificially induce ovulation and fertilization. ठीक है? Good. Second, in males they are given for cryptorchidism. Okay, or testosterone deficiency. Due to hypothalamic or pituitary cause. Due to hypothalamic or pituitary cause. ठीक है, अगर hypothalamus and pituitary are not producing LH and FSH hormone, then we give them from outside. Very good. Okay, now side effect of these drugs. Sir, this is ovary. FSH and LH, they act on ovary, they stimulate. Their side effect is ovarian hyper stimulation syndrome. Ovarian hyperstimulation syndrome क्या होता है बच्चों? ये in ovarian hyperstimulation syndrome there is increase in size of ovary, which will lead to pain, abdominal pain, and it may also cause a rupture of ovary because size बढ़ गया, and the female will go into bleeding and shock. Now, why I am telling you this part? बच्चों tell me one question. Tell me one question now. Which of the following drug, which I have told you, which of the following drug, just see this slide. Can you tell me among these drugs, which drug will cause maximum ovarian hyperstimulation syndrome? इनमें से सबसे ज्यादा ओवरी को कौन स्टिमुलेट करेगा? टेल मी द आंसर. Which of the following drug causes maximum ovarian hyperstimulation syndrome? This question has been asked. Tell me the answer. Which of the following drug causes maximum ovarian hyperstimulation syndrome? What should be your answer? Tell me the answer. इन सब में से सबसे ज्यादा ओवरी को कौन स्टिमुलेट करेगा? ओवरी का साइज बड़ा होगा, ओवरी रप्चर हो जाएगी, फीमेल विल गो इनटू ब्लीडिंग, शॉक एंड डेथ. Yes, answer is maximum is by human menopausal gonadotrophin, HMG. Human menopausal gonadotrophin, which contains both FSH and LH. HMG, human menopausal gonadotropins. Yes. So this completes gonadotropins. Let's talk about now gonadal hormones. They are also known as sex steroids. Okay, dono, HMG. We know that there are three gonadal hormone: estrogen, progesterone, and testosterone. Testosterone, or you will write androgens. Easy. So स्टेरॉन वर्ड इज कमिंग. स्टेरॉन मतलब कुछ स्टेरॉइडल हार्मोन. फर्स्ट यू विल राइट फ्यू पॉइंट. नेचुरल estrogen, progesterone and testosterone, they are not given orally. First MCQ. Natural estrogen, progesterone and testosterone, they are not given orally. The reason is they have a very high first pass metabolism in liver. They have a very high first pass metabolism in liver. First MCQ. So how they are given? They can be given as a transdermal patch. Why transdermal patch? Because transdermal patch avoids or bypass the first pass metabolism in liver. They avoid first pass metabolism in liver. Second point, when they come into the blood. When they come into the blood, so this is absorption. Now when they come into the blood, in blood they are bound to albumin and sex hormone binding globulin. Inside the blood, they are bound to two proteins, albumin and sex hormone binding globulin. Okay. Third point, you will write that they are excreted in bile. They are excreted out in bile. Suppose this is liver. Liver secretes estrogen, progesterone and testosterone in bile. Okay. So this is bile, GIT, bile में आते हैं. Now when this estrogen, progesterone and testosterone, they come into the bile, with the help of bacteria, they are again absorbed into the blood. With the help of bacteria, they are again absorbed into the blood, and hence they undergo enterohepatic reabsorption. They undergo enterohepatic reabsorption. Elagolix. Elagolix. The fourth drug was elagolix. अच्छा, gonadotropin. Beta HCG. Beta HCG. Human choriogonadotropin. Okay. So this is the normal things which I have told you about these three drugs. Okay. Three. Let's start with the first sex steroidal hormone. Let's start with Give females more respect, ladies first, estrogens. Let's talk about estrogens first. Okay, let's talk about estrogens first. Now, you know that, okay, the three main estrogen which is produced in the body are E1, natural estrogen, E2, and E3. Estrone, one word is coming, estradiol, and estriol. Estriol. Okay. Now, which is the major form of estrogen in a normal female as well as pregnant female? This one. This is the major form of estrogen. Okay. Now we know that these estrogens, they are not absorbed orally. They are given as a transdermal patch. In HRT. Can you tell me the full form of HRT? Hormonal replacement therapy. Hormonal replacement therapy in postmenopausal female. Now we have made synthetic estrogens. Synthetic, they can be given orally. Synthetic one, they can be given orally. Let's see what are the drugs. The first drug among synthetic we will write is, okay, synthetic we will write is, just a second, yeah, ethinyl estradiol. You'll write it is the most common form of estrogen used in OCP and HRT. The most common estrogen which is used in oral contraceptive pill in premenopausal female, HRT is given in postmenopausal female, is this mistranol. How to remember? ESTR word is coming, same use. Tibolone, okay. Tibolone has little bit of testosterone property also. Hence, its side effect will be hirsutism and acne. Fourth, diethyl stilbestrol. Diethyl stilbestrol. How to remember? Estrone word is coming again. So you can see estrol word is coming. Estrogen, estrogen, estrogen. Now diethyl stilbestrol is given for the treatment of prostate cancer, but it is not the drug of choice because this estrogen will decrease gonadotrophin releasing hormone, and this decrease in gonadotrophin releasing hormone decreases testosterone production. And prostate cancer is a testosterone dependent cancer. ठीक है? But you will write a very important point, very commonly asked question about this diethylstilbestrol. Diethylstilbestrol, when it was used in pregnant female, it leads to vaginal cancers in offspring within 10 years. So its use was very much discouraged. ठीक है? And it causes hypospadiasis in males. ये फीमेल में लिख लो, ये मेल में लिख लो. This is a very commonly asked question. Beta, in vitro fertilization whole procedure you will learn in obs and gynae. Okay? obs gynae का पार्ट है. फार्मा में कुछ लेना देना नहीं है इसका. अगर फार्मा में लेना देना होता, I would have been a billionaire till now. If in vitro fertilization is a part of pharma, I would have been a billionaire till now. Okay? So that is why I am not teaching you in vitro fertilization, not the part of pharma, not given in your books also. है ना? आगे बात करते हैं. ठीक है, आगे बात करते हैं. Fifth drug, dinesterol. It is given as a topical vaginal cream for treatment of senile vaginitis postmenopausal symptoms. ठीक है बेटा, ई नहीं है, एफ है. ई से इस्ट्रोजन. यार आप तो यार जज्बातों से खेल रहे हो मेरे. ई क्या है यार? यू आर मेकिंग मी इमोशनल. आई विल क्राई if you are asking me what is E. Hypospadiasis. Hypospadiasis. Epispadiasis. ठीक है? Now let's talk about what is the effect of estrogen in our body. Why I am telling you this physiology of estrogen? Because after that I will tell you a very important class of drug that you will understand very easily now. First effect of estrogen you will write is estrogen is good for bone. Why? Because estrogen, E for estrogen, increases the production of one protein, osteoprogerin. This osteoprogerin block rank receptor on osteoclast. Hence, they inhibit osteoclast. Hence, this estrogen is given for the treatment of osteoporosis. And deficiency of estrogen causes पोस्ट मीनोपॉजल ऑस्टियोपोरोसिस। समझ आ गई कहानी बच्चों? ओके, समझ आ गई ये बात? वाई एस्ट्रोजन इज गुड फॉर बोन? एस्ट्रोजन कॉजेस बोन मिनरलाइजेशन, ऑस्टियोक्लास्ट को इनहिबिट करता है एस्ट्रोजन। गुड, वी नो दिस पार्ट नाउ, वेरी गुड, शाबाश। नेक्स्ट पॉइंट वी विल राइट दैट estrogen is good for lipids. बेटा हाइपोस्पेडियासिस आई होप यू हैव लर्नड इन एनाटॉमी। एनाटॉमी में नहीं पढ़ा तो सर्जरी में पढ़ लेना, ठीक है, बाद में भी आएगा। ईस्ट्रोजन डिक्रीजेस एलडीएल लेवल and decreases triglyceride level while estrogen is given increases. Okay, but you will write estrogen, but you will write that testosterone has opposite effect, it is bad. Progesterone is also वैसे bad because testosterone increases LDL level, triglyceride level, decreases HDL level. बच्चों एक बात बताओ, बच्चों एक बात बताओ, एक बात बताओ, ज्यादा हार्ट अटैक से कौन मरता है? आदमी मरता है कि औरत मरती है? Which person dies more frequently with heart attack because of atherosclerosis? Tell me बच्चों now. I am getting emotional now. Tell me who suffers from more heart attack? Male or female? कौन मरता है हार्ट अटैक से? कौन जल्दी मरता है? Males. Being a male itself is a risk factor for MI and stroke. Can you tell me why? आदमी होना ही, male gender is a risk factor for having for MI and stroke. आदमी होना ही हार्ट अटैक का कारण है because of testosterone. Testosterone is bad, it causes atherosclerosis. Females are naturally protected. Okay, तो पोस्ट मीनोपॉजल फीमेल में MI का रिस्क बढ़ जाता है, बट प्री मीनोपॉजल तो इसीलिए यार फीमेल्स ज्यादा जीती हैं. फीमेल्स आर इवोल्यूशनरी, इन इवोल्यूशन ऑल्सो फीमेल्स आर मोर फिटर टू सर्वाइव इन एनवायरमेंट, है ना. फीमेल्स आर मोर फिट एज कंपेयर टू मेल इन इवोल्यूशनरी पॉइंट ऑफ व्यू ऑल्सो. ठीक है, चलो आगे बात करते हैं. कुछ नहीं कर सकते यार, अब भगवान ने ही हमारे साथ, और गॉड हैज created a partiality, we can't do anything. I'm really sorry guys, I'm really sorry. Then you will write that estrogen increases clotting factor synthesis. चलो अब फीमेल्स के बारे में आते हैं, बहुत हो गया मेल्स की बैशिंग. नाउ लेट्स बैश सर्टेन फीमेल, लेट्स डू सर्टेन फीमेल बैशिंग. Estrogen increases 2, 7, 9 and 10. Estrogen decreases protein C and protein S. Yeah, let's do some female bashing now. बहुत हो गई मेल बैशिंग. Hence, सर ये तो वारफरिन का ऑपोजिट निकला. अरे वारफरिन का ऑपोजिट निकला, देन एस्ट्रोजन कॉजेस thromboembolism. अरे माय गॉड, thromboembolism means DVT and pulmonary embolism is more commonly seen in, sir, females. Now we are proud to be a male. हम हार्ट अटैक से मरते हैं, सडनली मरते हैं, कोई बात नहीं, बट छोटा सा पल्मोनरी एम्बोलिज्म जिससे सांस फूलेगी, वो तो फीमेल्स में ज्यादा है. ठीक है, चलो लेट्स, सो प्राउड टू बी अ मेल. कोई बात नहीं, हमारे लंग्स सुट्टा पीने से खराब हो जाते हैं. ठीक है, सो रिमेंबर, सो इट इज अ प्रोकोगुलेंट ऑल्सो. ओके, कीपिंग दिस थिंग इन माइंड, लेट्स स्टार्ट विद अ क्लास ऑफ ड्रग. ओके, लास्ट पॉइंट यू विल राइट दैट एस्ट्रोजन, एक पॉइंट और लिख लो, increases the risk of breast, endometrial and cervical cancer. Okay, and you'll write hepatic adenoma also. Certain cancer risk is also increased by estrogen. Okay. एमिनेम जी सुट्टा उट्टा नहीं पीना बिल्कुल भी, नॉट अ गुड थिंग. डोंट, नो स्मोकिंग. ओके. एमिनेम जी, नो स्मोकिंग. एक लाइफ है यार, एंजॉय करो उसे. ड्रग्स में क्यों डाल रहे हो? खुश ही रहना है तो ड्रग्स में मत जाओ. और भी चीजें हैं खुश होने के. शादी मत करो. डोंट गेट मैरिड, यू विल रिमेन हैप्पी. व्हाई यू नीड अ टेक अ ड्रग? जरूरत नहीं है. डोंट गेट मैरिड, यू विल रिमेन हैप्पी. है ना? चलो. Keeping this thing in mind, let's talk about a class of drug known as SERM. Very important topic. I hope now you will understand each and everything why I was telling you all this point, because to learn this class of drug SERM. SERM stands for selective estrogen receptor modulator. Selective estrogen receptor modulator. Now what does the definition? Definition means that these drugs will act as an estrogen receptor agonist at some organs, while they act as an antagonist or blocker in other organs. कई ऑर्गन्स में ईस्ट्रोजन के रिसेप्टर को स्टिमुलेट करेंगे, कई ऑर्गन्स पे ईस्ट्रोजन के रिसेप्टर को ब्लॉक करेंगे. हेंस कैन यू सी दिस नेम, सिलेक्टिव ईस्ट्रोजन रिसेप्टर मॉड्यूलेटर. आसान हो गया काम. इन सम ऑर्गन दे विल स्टिमुलेट इट, इन सम ऑर्गन दे विल ब्लॉक इट. हाउ टू आइडेंटिफाई दिस ड्रग? वेरी इजी. All SERM they will end with the word phene or phene. They will end with the word phene or phene. If I'll say tamoxifen, reloxifene, clomiphene or meloxifene, phene word आ गया तो SERM. Keeping this thing in mind, let's see different SERMs now. Let's talk about different SERMs now. ठीक है? Let's talk about the first SERM, that SERM for ER positive breast cancer. SERMs for estrogen receptor positive breast cancer. And these drugs are, you will write, tamoxifen and torimifene. And reloxifene. आसान हो गया काम. ठीक है? Now we will write that reloxifene is an approved drug for prevention of breast cancer. ठीक है? It's a approved drug for prevention of breast cancer. Okay. Tamoxifen. It is the drug of choice for the treatment and prevention of breast cancer. ठीक है? Tamoxifen is the drug of choice for the treatment of prevention and the treatment of breast cancer. So now you know there are two drugs for prevention and one drug for treatment. For treatment, tamoxi. And this drug you have to learn in very great detail. Tamoxifen. Let's make a heading tamoxifen. Short note comes on this drug. We will write that tamoxifen is a trans form of estrogen ठीक है. Now let's see where tamoxifen is agonist and antagonist. This tamoxifen is estrogen receptor antagonist and estrogen receptor agonist at some organ. Very easy to remember. Antagonist. You'll write breast, blood vessels, and hypothalamic pituitary axis. It blocks. It is agonist at bone, liver, and endometrium. It is agonist at bone, liver, and endometrium. Now, bachcha log, let's understand. Let's understand the uses of tamoxifen. Tamoxifen is blocking estrogen receptor on breast. So uses. Tamoxifen is the drug of choice for the treatment of ER positive breast cancer. Why? It is blocking estrogen effect. Second, tamoxifen is also the drug of choice for prevention of breast cancer in contralateral breast. Tamoxifen is also the drug of choice for prevention of breast cancer in contralateral breast. Okay? These are the two uses. Now, advantage. Sir, it is acting as a bone. Can you tell me? It is a good drug for osteoporosis. It is a good for osteoporosis. ठीक है बच्चों? Disadvantage. Endometrium. It increases the risk of endometrial cancer. It increases the risk of endometrial cancer. समझ आ गई ना कहानी बच्चों? इजी है ना? Okay. Endometrial cancer. Last point, side effect. Last point, side effect. Bachcho, tell me one point. In liver, clotting factors, hence thromboembolism, blood vessels, hot flushes. Okay. अरे हाँ एंटागनिस्ट है ना ब्लड वेसल पे. So estrogen deficiency like hot flushes. Third point, it is hepatotoxic. Fourth point, it causes cataract. Why? Because it blocks some chloride channel on lens. ठीक है, all these are MCQs. All these are MCQ. Last point, property. Tamoxifen is metabolized by CYP2C19. Oh my god. Tamoxifen is metabolized by CYP2C19, SSRI, like fluvoxetine, is a CYP2C19 inhibitor. पढ़ा था ना, हमने पढ़ी थी ये बात. Hence, increases toxicity of tamoxifen. It increases toxicity of tamox. एक मिनट बच्चों, इसको 19 के बजाय क्या कर दोगे? जस्ट अ मोमेंट, जस्ट अ मोमेंट. CYP2C क्या था? 1 2 3 4 6. जस्ट अ मोमेंट, लेट मी चेक. CYP2D6 था. वही लग रहा था कि कुछ गड़बड़ है. CYP2D6. Why hot flushes? Because it is blocking the action of estrogen on blood vessels and vasomotor center. ब्लॉक कर रहा है. ब्लॉक करेगा तो पोस्ट मीनोपॉजल एस्ट्रोजन डेफिशिएंसी वाली स्टेट आ जाएगी. एस्ट्रोजन डेफिशिएंसी वाली स्टेट मतलब हॉट फ्लशेस. Okay, now write one very important point. Reloxifene has same effects like tamoxifen, except endometrium. It acts as an estrogen receptor antagonist at endometrium. बच्चों, tell me one point. Advantage. Do not increase the risk of which cancer? Endometrial cancer. सिर्फ एंडोमेट्रियम को काट कर एगनिस्ट से एंटागनिस्ट पे ले आओ, रेलॉक्सिफिन बन जाएगा. इफ यू विल जस्ट कट द पार्ट ऑफ एंडोमेट्रियम इन tamoxifen फ्रॉम agonist, put it in antagonist, it will become reloxifene. कहानी समझ आ गई? लिवर में मेटाबोलाइज होता है और लिवर को डैमेज कर देता है. दैट इज वाई हेपेटोट. बच्चों, जस्ट सी दिस डायग्राम फर्स्ट, देन आई विल एक्सप्लेन यू. If you will cut this endometrium and put here, it will become reloxifene. It will become reloxifene. ये बात समझ आई? So it is blocking estrogen receptor in endometrium. So बच्चा लोग, I hope this statement is understood, understandable. समझ आ गई ये बात? ये बात समझ आई आपको? रेलॉक्सिफिन और टेमोक्सिफिन में डिफरेंस. टेमोक्सिफिन इंक्रीज द रिस्क ऑफ एंडोमेट्रियल कैंसर, बट रेलॉक्सिफिन reduce the risk, or it will not increase the risk of endometrial cancer. Rest everything is same. बच्चों, tell me, reloxifin side effect, hot flushes, thromboembolism, hepatotoxic, same. Okay? Yes, good. So this is first class of SERM. Second class we will write is SERMs used for the treatment of postmenopausal osteoporosis. SERMs which are used for the treatment of पोस्ट मीनोपॉजल ऑस्टियोपोरोसिस, यस। बच्चा लोग, बहुत सिंपल सी बात, पहला लिखेंगे रेलॉक्सिफिन, सर दोबारा आ गया, बेजीडॉक्सिफिन, and लेसोफॉक्सिफिन। बच्चा लोग, दिस जस्ट मार्क इट इज वेरी वेरी इंपॉर्टेंट, very very important, okay, very important. So I will just write everything about reloxifin, and I hope now you know the answer. Reloxifin, it is given for the treatment of postmenopausal osteoporosis. Reloxifin is also given for prevention of breast cancer. Advantage, no risk of endometrial cancer. Side effect, just write two side effect, hot flushes, and just like tamoxifen, thromboembolism. I hope everything now is clear to you. I hope everything now is clear to you. Yes, but reloxifene actually is not approved for the treatment of cancer. That is the problem. Reloxifene कैंसर के ट्रीटमेंट के लिए अप्रूव नहीं है, प्रिवेंशन के लिए अप्रूव है, ठीक है, प्रिवेंशन के लिए अप्रूव्ड है, ट्रीटमेंट के लिए अप्रूव नहीं है, ट्रीटमेंट के लिए टमोक्सिफिन अप्रूव्ड है। अंडरस्टूड दिस पॉइंट? गुड, वेरी गुड। You'll write bezidoxifene. Oh my god, bezidoxifene. It is given for the treatment of osteoporosis, postmenopausal osteoporosis, and this bezidoxifene is also given for the treatment of hot flushes. इसका साइड इफेक्ट नहीं है ये, इसको तो ट्रीटमेंट में हम यूज करते हैं, ओके। So which SERM is also given for the treatment of hot flushes? Sir, bezidoxifene, blood vessel wala bezidoxifene. Third point, other SERMs. Third SERMs you will write. For ovulation inducer. जो ओव्यूलेशन कराएंगे बच्चों, टू ड्रग्स यू विल राइट क्लोमीफीन, सुना है नाम क्लोमीफीन? Full form is clomiphene citrate. Oh, and the second drug you can write is tamoxifen. Tamoxifen is also given for ovulation induction. उसको भी use करते हैं. Now here you will make a heading, this clomiphene, very important, very very important drug. Let's write clomiphene. Clomiphene is sometimes also known as anti-estrogen. Why? Because it blocks estrogen receptor at all sites. But remember, if somebody will ask you, clomiphene is an SERM or anti-estrogen, you'll write clomiphene is an SERM. Okay? But ये सब जगह पे estrogen के receptor को block करता है, but it is an SERM. Now, I will ask you one question. If clomiphene blocks estrogen receptor on hypothalamus and pituitary, sir, what will happen? If clomiphene will block estrogen receptor on hypothalamus and pituitary, what will happen? Can we say no negative feedback? Because of this reason, there is increase in level of FSH and LH, or gonadotropins, and this FSH and LH acts on ovary and it causes ovulation. Same thing happens with tamoxifen also. Ovulation. Okay. Ovulation. Because of this reason, let's see the uses. Clomiphene is the drug of choice for anovulatory infertility in PCOD. What सुना है PCOD? Polycystic ovarian disease. What happens in polycystic ovarian disease? There is no ovulation. Okay. Now, can you tell me what are the agents which we can give? Clomiphene, which is the drug of choice. Second one you will write is tamoxifen. Okay, which can be given in replacement to clomiphene. Third thing, can we give gonadotropins? Can we give gonadotropins like HMG, human menopausal gonadotropins? Yes, we can give directly. है ना? We can give FSH and LH directly. Lastly, you will write you can give letrozole. What is letrozole? I will tell you later on. In bracket, you will write aromatase inhibitor. So these are the agents which we give. For anovulatory infertility, what is letrozole? I will tell you later on. I hope the first three drugs are absolutely clear to you. First three drugs are absolutely clear to you. ठीक है? Second, it is given in vitro fertilization for extraction of ova. ठीक है? Clomiphene is actually partial agonist at ovary, but you don't have to remember it is anti-estrogen everywhere. Okay, it has some partial agonist action on ovary, but that point is irrelevant for you. Side effect, it causes multiple ovulation. Oh my god, एक भी बच्चा नहीं था, अब तो सर ट्विन आ जाएंगे, ट्रिपलेट आ जाएंगे. सो इट विल लीड टू मल्टीपल ओव्यूलेशन. देयर इज अ फीमेल हु इज आस्किंग, सर बच्चा चाहिए, आई नीड अ बच्चा, आई नीड अ बेबी. गिव क्लोमिफीन, हैव मल्टीपल बेबीज, हैव ट्विन, ट्रिपलेट एक्सेट्रा. फिर कहेगी इतने सारे नहीं चाहिए, कौन संभालेगा? दिस इज द प्रॉब्लम, मल्टीपल प्रेगनेंसी. सेकेंड पॉइंट, it causes ovarian hyperstimulation syndrome, है ना? Ovarian hyperstimulation syndrome. Okay. Now let's finish SERM. Other SERMs you will write बहुत बढ़िया ड्रग, सबने सुना है इस ड्रग का नाम. एनीवन हु नोज अबाउट दिस ड्रग? और मिलॉक्सिफिन, किसी ने सुना इस ड्रग का नाम? और मिलॉक्सिफिन. बस बच्चों खत्म होने वाला है, फिर ब्रेक देता हूं. आई नो यू आर वॉचिंग योर वॉच, आप अपनी घड़ी ज्यादा कॉमनली देख रहे हो एज कंपेयर टू लेक्चर. जैसे ही 1-2 मिनट रहते हैं 2 घंटे के ब्रेक में, ब्रेक ब्रेक ब्रेक, है ना? आफ्टर 2 hours यू सडनली कम इन टू ब्रेक ब्रेक ब्रेक. यू, आई नो दैट यू आर वेरी कॉमनली, यू आर फोकसिंग वेरी टाइटली ऑन योर रिस्ट वॉच और मोबाइल वॉच, है ना? आई नो दैट पॉइंट. और मिलॉक्सिफिन पे आते हैं बच्चों. सर दिस और मिलॉक्सिफिन, it is also known as centchroman. सुना centchroman? It comes with the brand name Saheli and Chaya. It was made in India. ऐसा हमें बताया जाता है पर असलियत कुछ और है. You'll write CDRI लखनऊ. CDRI लखनऊ. Oh, लखनऊ समाजवादी पार्टी. Connection with विकास दुबे. Central Drug Research Institute. Okay, Central Drug Research Institute. Okay, now or meloxifene, you will write use. First, it is a contraceptive. It is a contraceptive. Okay, why? बच्चा लोग एक बात समझो. Don't draw this diagram. This is fallopian tube. है ना? This is fallopian tube. This is endometrium. बच्चा लोग एक बात याद रखना. That for motility of fallopian tube, for the motility of fallopian tube, you require estrogen. You require estrogen. And for implantation also, you require implantation of embryo. You require estrogen. If you will block estrogen on fallopian tube and uterine endometrium, what will happen? There will be decrease in tubal motility and decrease in chances of implantation. Okay, there is decrease in chances of implantation. ये सहेली नाम से आता है ना, सहेली. पहले ऐड भी आती थी. Hence, you will write advantage. It is a non-steroidal contraceptive. Remember, estrogen and progesterone, they are steroidal drug. So it's a non-steroidal contraceptive. Second point, it's a weekly contraceptive. और ये तो दूसरा वीक हो गया. वीक का मतलब लिखेंगे वीकली कॉन्ट्रासेप्टिव. वही वाला लिखना था सर. वीकली मीन्स इट इज गिवन वंस अ वीक. Disadvantage, it has a very high failure rate. It has a very high failure rate. Other point, you will write that it is good for dysfunctional uterine bleed. Dysfunctional uterine bleed occurs because of excessive estrogen, and it is protective for breast cancer, but it is not approved drug. It is protective for breast cancer. Okay. साइड इफेक्ट, सर अगर इस्ट्रोजन नहीं होगा, एंडोमेट्रियम प्रोलिफरेट नहीं होगा, मेंस्ट्रुअल ब्लीडिंग कम हो जाएगी. इट कॉजेज हाइपोमेनोरिया, लेस मेंस्ट्रुअल ब्लड फ्लो. Because of this reason, it is given in dysfunctional uterine bleed also. When there is abnormal or excessive bleeding, it is known as dysfunctional uterine bleed. कहानी समझ आ गई? कहानी समझ गए? Sir, this completes SERM. Last two miscellaneous drugs we will write. SERMs are finished. Two drugs I will tell you, then I will give you break. Only two drugs are there, then I will give you break. Okay? ठीक है. पहला ड्रग फुल, ओ माय गॉड, वेस्ट्रांट. फुल वेस्ट्रांट. सर फुल का मतलब फुल का मतलब एवरीवेयर, एवरीवेयर, ऑल साइट, ESTR, इस्ट्रोजन, ANT, एंटागनिस्ट. Okay, this fulvestrant is known as SERD. It is not an SERM, it is SERD. That is selective estrogen receptor डाउन रेगुलेटर. ये रिसेप्टर को ही खत्म कर देता है, ब्लॉक नहीं है, खत्म कर देता है रिसेप्टर को. सर यूज क्या होना चाहिए? बड़ा लॉजिकल यूज होना चाहिए. दिस फुलवेस्ट्रांट इज अ ड्रग ऑफ चॉइस फॉर टेमोक्सीफीन रेजिस्टेंट, ओ माय गॉड, ब्रेस्ट कैंसर. अगर टेमोक्सीफीन काम नहीं करता तो हम फुलवेस्ट्रांट यूज करते हैं. If tamoxifen doesn't function, then we give fulvestrant. I hope you have understood. Simple है ना? समझ गए? समझ गए बात? Yes. Sir, next point we will write the last drug, then I will give you break. The last drug we will write is aromatase inhibitor. Aromatase inhibitor. हाँ बेटा, it is protective for endometrial cancer. It is protective, but we will not write that part. I know now you have understood the whole concept. Fulvestrant will be protective. इसका side effect क्या होगा fulvestrant का? Post menopausal symptom बढ़ जाएंगे, है ना? So we know this part. If you know the normal mechanisms of estrogen, normal physiology, you can predict a drug. But that is not asked. What is asked we have discussed. Now बच्चा लोग, what is this aromatase enzyme? Let's understand this part. Sir, the function of aromatase enzyme is to convert testosterone into estrogen. And this aromatase enzyme is present in adipose tissue. Oh, okay. Okay. It is now this estrogen is the source of estrogen in males, and it is the source of estrogen in postmenopausal females. Okay, it is the only source of estrogen in males, and it is the only source of estrogen when the ovaries are not producing estrogen in postmenopausal females. Yes. So let's talk about now what are the drugs. But first I will tell you the use. Aromatase inhibitors, they are the drug of choice. Estrogen receptor positive breast cancer in postmenopausal female. Do you agree with this part? In premenopausal female, we give tamoxifen. In postmenopausal female, we give this drug. Okay, let's see what are the drugs we have. The drugs among aromatase inhibitor you will write is, the first drug you will write is, okay, aminoglutathione. Okay, it is a non-steroidal drug. ठीक है, non-steroidal aromatase inhibitor. It is also known as first generation. Second, you will write formycin. It is a steroidal drug. It is known as second generation aromatase inhibitor. And now you will write exemestane. It is a steroidal drug. It is known as third generation. And you will write fourth, letrozole, vorozole, anastrozole. Now बच्चा लोग at least try to remember these names. They are very commonly asked question. You'll write that they are non-steroidal drug. And they are also third generation aromatase inhibitor. And now they are considered as a drug of choice for postmenopausal breast cancer. Which drug now we use? This one, non-steroidal. ठीक है? Sir, can you tell me their side effect? सर जो भी बचा खुचा इस्ट्रोजन था पोस्ट मीनोपॉजल फीमेल में वो भी आपने निकाल दिया. Whatever the little bit amount of estrogen was produced from testosterone, you have removed it. Oh my God. So they will aggravate osteoporosis. They will aggravate hot flushes, post-menopausal symptoms, and they will aggravate depression. So this is again a very commonly asked question. There will be absolute estrogen deficiency. So aromatase inhibitor will cause osteoporosis. But tamoxifen, what about tamoxifen? Tamoxifen was good for osteoporosis. Okay. Tamoxifen is good for osteoporosis. Now among them you will write letrozole. It has been approved as an ovulation inducer in PCOD. Okay, and it is better than clomiphene. But the drug of choice I have told you is clomiphene. ठीक है? ठीक है? So this finishes it, but I want to tell you the concept behind it. Sir, I have posted one flashcard on PCOD. I hope you have seen on group. Group में देखा है आपने PCOD पे हमने एक flashcard बनाया. Have you seen that flashcard on group? Why? Just see that flashcard on group. Why letrozole is used? What is the reason why there is anovulatory infertility and why there is infertility and why we give aromatase inhibitor letrozole? Just see that flashcard of PCOD, you will come to the answer. And this completes our estrogen. Let's take a break. After the break, we will finish endocrine. Okay, after the break we will finish endocrine. You can give any drug, बच्चा लोग, you can give any drug among them. तीनों में से कोई भी ड्रग यूज कर लो, बस ड्रग की क्लास का नाम आपको पता होना चाहिए. बेटा फेसबुक, फेसबुक पे भी है, ई मेडिकोस पे भी है, सब पे पोस्टेड है बच्चों. सी दैट फ्लैश कार्ड. अगर नहीं देखा तो अभी देख लेना, ब्रेक में देख लेना. ठीक है, उसमें पूरा पीसीओडी क्यों होता है, कैसे होता है, फार्मा का पार्ट नहीं है, ऑब्स गाइनी का पार्ट है, बट क्यों यूज करते हैं ड्रग वो लिखा हुआ है. तो यहां पे हमें नहीं पढ़ने की जरूरत. यस, पीसीओडी सीन इन थिन फीमेल्स और ओबीस फीमेल. टेल मी बच्चों, पीसीओडी किस में देखा जाता है, थिन फीमेल्स और ओबीस फीमेल्स. ओबीस फीमेल्स. ठीक है, मोर एरोमेटेज एंजाइम, मोर टेस्टोस्टेरॉन, है ना, पढ़ोगे आप. व्हाट इज फ्लैश कार्ड? ओ माय गॉड, दिस इज अ वेरी वैलिड क्वेश्चन. व्हाट इज अ फ्लैश कार्ड? ओके, ये आपने बहुत अच्छा सवाल पूछा. एक फ्लैश कार्ड मतलब एक फोटो बनाई हुई है बच्चों. ओके, नो यू डोंट हैव टू राइट दैट फ्लैश कार्ड. ओके, ओके, you don't have to write about that flashcard. Just see for your knowledge only. नॉलेज के लिए मैं आपको बता रहा हूं. क्लोमिफीन साइड इफेक्ट बच्चा हमने लिखा ना, मल्टीपल ओव्यूलेशन, ओवेरियन हाइपर स्टिमुलेशन. ओके, चलो ब्रेक लेते हैं. राइट नाउ इट इज 1:17 PM, 20 minutes break, 1:37 PM. ठीक है, चलो लेट्स हैव लंच, ब्रंच, वट एवर यू वॉन्ट टू हैव टी, कॉफी, get refreshed, and let's join again at 1:37 PM. ठीक है, so today we will finish endocrine. So let's take a break.